different, right? So I'm gonna give those details, and also every presentation has few sessions of each part of the prep. If you have questions, please stop me at any time, and I'll be more than happy to answer any questions. So I think we have everybody. Can we start 6, 7, 8 people, I guess. Let me see. So I think we are good to go. I'll start the presentation. So first of all, thank you, Caapid Simplified, especially Flynn and Meenakshi Subramaniam to reach out and make that initiative talk with me. And I'm more than happy. I'm really happy that I'm able to do this today. Let me introduce myself. Tarun Teja Bike Reddy. Long story. I don't want to talk more personal details about what do I do with. So anyway, I have this question all the time. With a lot of students, like they will send me a message from nowhere in Instagram saying like, can you share me your profile, tell me about your journey so it can help me. So I'm going to briefly talk about my journey quickly for a couple of minutes so that you guys understand where I come from. So I'm originally from Tirupati, southern part of India. I graduated in 2012. It's been a while, stopped practicing. I moved to Canada in 2016 as a student, studied dental office administration, healthcare administration as diploma programs. And we have to have survival mode. So I found a job. I started as a receptionist in a dental office. I am proud to say that I'm a roti maker too. I worked in a restaurant for almost 2 years when I was a student. Used to make 500, 600 naans and rotis every day in the restaurant while I was studying. It was crazy. So I started as a receptionist in a dental office and slowly became a treatment coordinator, then a manager for 3 practices altogether. And I did certification in infection control, and eventually I was able to teach business administration, infection control, and clinical integrity for dental hygiene students in a dental hygiene school for 2 years. And then that actually, I slowly built my profile just around dentistry with all that I was roles and responsibilities in dental practice. And then eventually, this was my first cycle. Technically, I applied to a few schools, and I got Buffalo and Pacific, but Pacific I did not attend the interview because I was very confident that I would get into Buffalo. So here I am. So the reason I put this picture here, Sulphur Skyline in Alberta, which is the picture I really admire. I've been there in like a while ago. Everybody, I mean, I'm really bad at pep talk probably, but this is something, the only pep talk I'm going to give you guys for the presentation. So I'm from Canada, as you guys already know, probably know. So I moved to Canada and then I got settled there. I got my PR and then citizenship. So through this process, I had so many hurdles. It was not easy for everybody. It is not easy. I totally understand that. So I took my AFK exam and I did not pass my AFK exam in my first attempt with one point. Supposed to get 75, I got 74, and I was so devastated. I thought I will give up. And eventually, I took the second attempt of AFK exam, and somebody shared questions in the groups, and they voided the entire test for everybody who took the test for that cycle in 2019, I believe. That was even heartbreaking, that I was like, I know that I would pass that test because I did really well. And then they voided the test. After that, I tried to take the exam. It happens only once in six months, and I couldn't book it for 2 consecutive 6 months and wasted 1 year of time. And I was so depressed. I had my rock bottoms, and all our friends planned to go to Alberta. So this is our first trek, and this is actually first trek in Canada I ever had. And it took us 5 hours to trek all the way up. And we started 4 o'clock in the morning to see the sunrise in the morning. So we started, and we actually saw a bunch of foxes and also a bear. But anyway, we made it on time to see the sunrise. And I don't have the actual picture of the sunrise which I took because it was not that great of a picture because I didn't have a camera at that point. So this is picture from Google. I just searched up and looked it up. It was so beautiful. The day I stood there and saw the sunrise, golden sunrise going on towards the mountains, and made me realize that there is always hope. So please don't be hard on yourself. There is always a second chance, there is always a third chance until you are alive, to be honest. So don't give up on anything. Please keep the hope going and work towards it. If you don't put effort towards it, you might not get it. So that day I decided that I'm going to take INBDE and start my journey towards the US admissions. Um, so that is the most memorable day for me. Have that realization for myself. That's why I put that picture there. And that's my one of the pictures, one of the best pictures. I have this tradition of taking picture of the famous School of Dental Medicine board in front of the Square Hall. You guys will see it on Tuesday when you go. Please do take pictures of it. It's a brand new board. It is the first day. We had the previous board, it was all wrecked out, and they changed it for their CODA accreditation recently. So it's a brand new board. That was the first picture with the brand new board. So please do take the picture and keep it a memory for yourself. And coming back to the contents, okay. So we'll be talking about class 2 amalgam preparation and restorations, and class 2 composite preparation considerations and restoration 2. And all ceramic crown, because these are the these are the 5 major tasks that you'll be performing on Tuesday. And it won't be crazy. You guys all know how to make a class 2 prep or class 1 prep or crown prep 2. And I know at this point you all would have practiced like probably 100 preps of each thing, which I did too. But these are something which are the main considerations that you have to keep in mind. These are critical points which I'm going to say that will actually make you pass. So I was excited to share with you guys about the grading criteria, which I wanted to share it, but I'm not supposed to share it because it's a confidential document from the school. But personally, I remember everything which I put onto the presentation for you guys to share my knowledge, which I learned from Buffalo. And again, why Buffalo? Buffalo is one of the schools which actually invited me, first of all. I was very hopeful to go to UPenn too, but I did not get an invite from UPenn, but I guess it's their loss. But Buffalo is very close to Canada. For me, it is like an hour and a half drive if I have to go. And it feels like home. The weather is the same, and the city is beautiful, very small city. And apart from geographies of Buffalo is something you can learn a lot. And it is the culture in Buffalo is completely, I mean, University at Buffalo School of Dental Medicine is completely different what I experienced in my entire life. So SDM have this environment of they call it family. So everybody are open to talk to anything, and they are okay talking about anything. And they are open for questions. Everybody have open door policy. You just jump in, ask any question, ask for help. Everybody are very helpful. There is no chance of racism anywhere. There is no chance of discrimination. There is no chance of questioning. There is no such thing as dumb question. Everybody says there is no question as dumb question. Everybody asks everything. And you'll feel very welcome. And it is very warm environment where you can find that in any other school, I believe, because I had a lot of feedbacks from other schools too. And patient flow is decent, and we have decent amount of patients to get our requirements done. You don't have to bring your patients, they schedule it for you, and everything is paperless. We use one of the softwares for all the dental records. It's amazing so far. So I'm not gonna brag too much about Buffalo because I'm here. I'm gonna move on to the next slide. So this we are gonna again first one we will discuss is class 2 amalgam preparation. Remember guys, I know you guys would have got information from your WhatsApp group that there will be a tooth number 14 for your amalgam prep, but remember there are chances for them to switch the tooth, which they don't usually do. I know you guys will be like, oh, let me prepare number 3, like because they told me, blah, blah, blah. And then end of the day, you see number 14 and your burr orientation and hand orientation is completely different. And don't be shocked if you see the tooth which is changed. But I am 110% positive that your amalgam class 2 prep will be on a maxillary molar. So any questions about that? So you guys are clear with it? I guess so. Okay, so again, this picture I put it because wanted to tell you guys how lucky you guys are that you don't have to put on a rubber dam in Buffalo bench test. So putting a rubber dam is actually a lot of time taking process. I know you guys might have been like pros at it by now, but it is actually challenging to put a rubber dam in one shape because they have requirement and criteria for it. They want all the rubber dam ends to be inward towards gingiva, and then have a wedget on the other end, and make sure you clamp the adjacent teeth, number of teeth count, blah blah blah. So this is one of my preps for amalgam pin retain restoration in my preclinicals in summer program. Anyway, so remember that you guys are lucky. And next presentation, let's see. Okay, so these are the key criteria or considerations for your amalgam prep. So I'll go through each one. So all the pit and fissures are to be included. This is something they have it in their grading criteria. And if you miss any pit and fissure, you will be in trouble. It is not an excellent prep. It will be a standard prep. So again, before I continue, I'm going to quickly tell about grading criteria in Buffalo. Okay, let me see if I can put a full screen. Sorry, guys. I am really... Can you guys see this better? Can somebody help me answer this question?
Yeah, we can see it, doctor.
Okay, got it. So you have to make sure you include all the pit and screws. Hello.
Even I cannot see the screen fully.
Okay.
Is there anything that we have to adjust, or I'm like?
Let me try. Sorry, guys.
Mahima, you can't see the presentation, or you can't see Dr. Tarun's screen?
Yeah, I mean, like, we can't see the presentation and the full screen. Like, it is like...
Yeah, Tarun, correct. Yeah, it's not on the presentation mode. Yeah, now it's on the...
So when I click on the presentation mode, it kicks me slideshow. Click. Yeah. Can you guys see the presentation mode?
I think you're sharing the PPT window and not the slideshow window.
Okay.
Could be that, yeah.
I think I'll do better next time, guys. So,
Doctor, if you click on the slideshow, I think it will show the presentation mode.
Let me, when I click on this, it's not gonna... Okay, so let me do this again. Oh my God. So if I click on the slideshow mode, it actually kicks me out of Windows, sorry, Google presentation. But you guys can see the presentation, but
yeah,
right?
You can see the presentation, correct? Yeah.
You guys can you guys see me still on the sidebar?
Yes, doctor, we can see.
Okay, there you go. That works. I don't have to. As far as you guys can see me on the side and then see the entire presentation, we should be good, right?
Yes, doctor. Yeah.
Is that the case? Okay, perfect.
Yeah.
So I got some of my models with me. Just wanted to show you guys. I marked a preparation to see. I guess you guys already know how pit and fissures are, and then the description of it, because this is a Frasco model. It is very defined in this, but in your Kilgore model, it is not that defined. But make sure you include all those pit and fissures into your cavity. but you don't have to extend the cavity to include the fissures more buccally and lingually. So that is something you have to keep in mind, that you don't have to include a lot of buccal and lingual incline fissures which are coming into the center pit and grooves, but you have to make sure you include the entire pit and fissure part in the occlusal central part of it. And also your cavity design should be more centered. It can be more buccal, it can be more lingual, it can be more mesial or distal.
Doctor, I have a request.
Yes.
We couldn't see your model very clear. Is there any way that you can also share the picture after?
Yeah. So I took a bunch of pictures for this. Once I finish this presentation, we will also go through each picture. I saved all of them in one of the folders where I can zoom in better to show you guys the detail of it.
Okay, sure. Because I really wanted to see the ideal prep for, what they look like.
I know I will have this question. So I took like decent pictures of all of my preps.
Okay.
And I'll go through each prep and explain you what the picture is about, so that we'll go through that, because that's why I made the presentation smaller, so we can talk more about the preparation, because you guys have just to make the notes for these details. So please make sure you write down these numbers and remember to have them in mind, so that we can discuss more how the prep is on the pictures. Okay.
Perfect. Thank you so much.
Okay. No worries. And also, they always say that buccolingually, the width of the cavity occlusally should be 1 to 1.5 millimeters. But we always used amalgam condenser short end or small cylinder on the front to pass it through, so that it is going through unobstructed.
So the condenser is 1 millimeter, right? The smaller
Yeah,
end?
usually it is 1 millimeter. So
if it is okay, if it is going like unobstructed, then it's good.
Then it is good. You don't have to make it more. Remember, again, before I continue, I have to emphasize this again to everybody. Buffalo expects everybody to do any prep extremely conservative. Again, I'm going to emphasize this again and again. All the preparations that you make should be extremely conservative. So if they say 1 to 1.5, I would keep it 1 exact, not below that. So if you go beyond 1, I wouldn't go beyond 1.25, but it is still acceptable. And also remember, when I say 1 to 1.5 millimeter buccolingually, means if you keep 1 to 1.5, you have an excellent prep. If you go beyond 1.5, but still be till 1.75, you have a standard prep or acceptable prep. But if you go less than 1 or go beyond 1.75, it is a critical error and it is not acceptable prep. So this is usually the grading criteria for most of the clinical tasks and preclinical tasks we have. They have excellent preps, standard, and clinically unacceptable. So if you fall in standard and excellent, you will definitely pass your bench. If you have all of them excellent, I mean, every part of it, let's say pit and grooves are included, that is 1 point. 1 to 1.5 millimeter buccolingually, 1 point. Free contact clearance on buccolingually, 1 point. So each one will have 1 point. But if you have it under standard, you will have only 0.5 or half a point. Something like that. We don't know if they give 2 points for this or 1 point for this, but still, that is how the system works in Buffalo. So make sure you try to be in the excellent prep condition. And if you make some silly mistakes, which can fall on standard, but do not even have 1 critical or unacceptable error. Even if you have 10 tasks, 10 criteria for each prep, and you have all 9 of them excellent, and you have 1 criteria which is falling under clinically unacceptable, the prep is a fail. And they won't accept all the other 9 criteria if you got excellent. So make sure you fall in your excellent and standard requirements. So whenever the reason I can't share it because it's a confidential document. Again, I'm giving you verbal advice that if I say 1 to 1.5, that is a excellent numbers. Are we clear on this, guys?
Yes.
Okay, thank you. So buccolingually, it is 1 to 1.5 millimeters, as I mentioned, and make sure it is in the center part of the cavity. And this is something most of us have problem with. Free contact. So you have to break the contact. Make sure you break the contact both buccally and lingually. As such, you have clearance of 0.25 to 0.5 millimeters, not more than that. So I would say 0.5 is dead requirement. Like you cannot even go 0.6 on the buccal or lingual clearance. If you go more than that, it is not an acceptable prep again. But you can still have less clearance, but make sure you fall in 0.25. And moving on to the occlusal internal form. For amalgam prep, as you guys all know, you have to have convergent walls occlusally, but it's not obvious like this. If this is 90 degrees, you're just doing convergence like this. That's it. And your burr will automatically create that convergence a little bit, but we'll talk about the burrs again. Like I have another slide for it to discuss which burr will go where, so that it will help you guys understand. So if this is 90 degrees, you're doing a convergence like this. So start preparing a 90-degree cavity with most conservative buccolingually 1 millimeter. And then once you finish your occlusal outline form, use the burr to tilt it with 15 degrees tilt, and then with slow speed, as in electric high-speed handpiece, but you can control the speed on the display. So you can control the speed to 40K, not 200K or 150K. Then use it to 40K, and then pass the burr in 15-degree angulation all along the walls, so that it will create that occlusal convergence buccolingually. You don't have to create that occlusal convergence on the if you're doing an MO on the distal side of the cavity, where they call it a dovetail. It is not an ideal word anymore, but you don't have to create that occlusal convergence on the dovetail area, the proximal area of it. Only buccolingually, and that buccolingual convergence should actually continue in the box as well. So if we are looking at the proximal box, it has to be convergent. It has to be convergent occlusally. And next one. So this is something everybody have problem with. Horizontal pulpal floor. I know you guys try to make it smooth. More than having the floor smooth, it has to be flat. It can't start from one point and go all the way down to the proximal box. It has to be straight on the both ends, and they measure it actually with a perioprobe. I'll show you guys a picture how they measure it, so that you can help also. So how do we do it? Most of them, what they do is they find a first point where they drop the burr, and then take it out and then connect it towards the proximal side. Most of them do it. I'm sure half of you guys not do it, but remember, measure the burr, how long it is, and see how much depth you want, and then drop the burr with the whole depth at the initial point where you're going to make the cavity, and then do not lift the burr and do not push the burr. Once you see the burr is all the way in with 1.5 millimeters or 1.75 millimeters, do not lift the burr, go straight, maintain the axis of the burr with the long axis of the tooth. Do not tilt the burr, do not tilt the burr any directions. Make sure you are in parallel to the long axis and perpendicular to the occlusal floor, and then position it, drop it, and then draw it all around the pits and fissures without moving the burr up or down or buccal or lingually or mesial or distally. So it has to stay in the same point. You just draw it along the pit and fissures and then come to the proximal box of it, so that you will maintain the height of that 1.5 where you dipped into the cavity and continue all the way along. If you tilt the burr, you are making it divergent. If you are putting more pressure than that 1.5 you achieved, you are making a slanting floor. So, and again, this is another critical criteria where they look at occlusal depth of the cavity. The deep depth of the cavity should be 1.75 to 2 millimeters according to our grading criteria for amalgam preps. But personally, how do we measure it? Again, I'll show the picture, which will actually make it more easy for you guys. 1.75 to 2 is excellent measurement, right? So 1.75 should be at the deepest point of your prep, and then 2 millimeters will be the highest point of your prep. So when you put your perio probe into the cavity, pass it all around the occlusal part of the cavity and see the deepest point of the pit, you measure 1.75, okay, good. And then you pass it, and then the cuspal inclination, highest point of the cuspal inclination should have 2 millimeters, not more than that. If you have more than that, it is again compromised prep. If you have less than 1.75, it is again compromised prep. So for amalgam, you need enough thickness so that the amalgam doesn't fracture. That's the reason we need that enough thickness of depth of the cavity. So 1.75 again, 1.75 on the deepest point, 1.2 millimeters on the highest point. Okay, do not think of going even 0.1 more than 2 millimeters, and that falls in standard. If you have 0.1 more, if you have more than 2.5, it is a critical error again. So again, I talked about the pulpal floor, right? So make sure you have it flat all around. And moving on to our proximal internal form. As I mentioned earlier, make sure the walls, buccal and lingual walls are convergent occlusally. And do not, they have to have 90 degrees with a very minute convergent tilt. That's what they say to us. They don't say, okay, they have to be convergent. They don't say us that. So they say, try to keep it as 90 as possible, but that 10 degrees to 15 degrees of tilt, occlusal convergence is more than enough. Don't go all the way to 25 degrees, which is not acceptable because it causes stress on the tooth structure, which is like a triangle piece left on the occlusal part, which will fracture. That's the reason they ask us not to make very deep and obvious convergence occlusally. Is that clear to everybody, that point?
Yes, Doc.
Perfect. Am I going good so far? Am I too fast? Am I too slow? Do you guys understand and follow what I'm trying to say?
Yeah, doctor, so far it is good.
Okay, perfect.
Yeah.
If there is anything, I'll stop you.
Yeah, stop me anytime. I'm more than happy.
Thank you so
Doctor,
much.
one request.
Yes.
Can you please also say the bird number? Like,
Yeah, we'll go through the birds. I think I have my next slide with birds, so we'll go there.
Okay, got
In
it.
a minute.
Thank you so much.
Okay, and we are not done with the box discussion here yet, right?
Yeah, so let me finish the box discussion, then I'll move to the birds.
Okay.
Got it. So sorry, I can't see your faces on the side or like your display of it because I just have the presentation in front of me and I'm talking to the wall basically, talking to the computer. Anyway, continuing with this, and also parallel to long axis. Okay, so some of us will actually tend to tilt the burr, especially the right-handed people who are in dentistry. So we try to tilt the burr axis towards our right all the time. What happens is when you're working on the proximal box, if you tilt your handpiece, you are actually undermining the axial wall. The axial wall should be parallel to the long axis of the tooth. So if you tilt your burr when you are making the proximal box, if you tilt the burr, you're undermining the dentin, and then the wall goes this way. It has to be straight and parallel to the long axis of the tooth. And again, remember, this is the pulp chamber inside this is the pulp chamber margin on the mesial surface on the inside the tooth. So the dentin is all around the pulp, right? So when you are making the cavity proximal box, you cannot make it straight buccolingually. If you make it straight buccolingually, you are coming close to the pulp. So, and you are reducing the thickness of dentin at most prominent point of the pulp, towards the pulp, which is actually we are putting the pulp in danger or creating that heat, which will transfer to the pulp and cause pulpitis or reversible pulpitis in future. So always remember to have that convex wall of the proximal axial wall. So from buccal to lingual, the proximal wall should go all the way around with a convex. Again, remember this. This is your pulp, and you have to follow this direction and create that convex wall. But still, it should be parallel in all the tangent you draw. It should be parallel to the long axis of the tooth. And again, this measurements 1 to 1.25 millimeters depth of the proximal box or 1 millimeter of height doesn't make sense to me and will not make sense to you too. But remember only this point. Drop 1 millimeter to 1.25 millimeters of your burr into the proximal box and create the box, and use your enamel hatchet to clean all the, make it more fancy, I would call it, like flat and straight. Once you do that a little bit, and then you will see if you have enough clearance on the gingival seat. They don't really care about the depth of the cavity. They do care about a lot for the clearance on the gingival seat. So if you try to make 1.5 to 1.25 millimeters of the cavity depth and you have more clearance on the gingival seat, you are in a problem again. So you have to find that fine balance of having the clearance of maximum of 0.5, yet to maintain the height of the cavity of 1.25. So to maintain the depth of proximal box to 1.25, you have to have the minimum depth on the occlusal. You can't go maximum. Does it make sense? So if you make, so that's why my cheat code is, if they say depth of the cavity is 1.75 to 2 millimeters, I would say 1.75 is still acceptable, especially with Kilgore models or brutal. I know the contacts are very thin. So I keep it 1.75 all around. I try my best to keep it between 1.75 to 1.85, not go to 2 millimeters on the deepest part of it, and still be in the range of acceptable range, so that I have less preparation on the occlusal part, and then which I can use to create that 1.25 millimeters or 1 millimeter of depth on the proximal box. So you have to find that fine balance of making sure the depth of that and depth of that are more closer and fall in the range of it, and which creates enough clearance in the gingival seat. And moving on, again, gingival wall should be horizontal. So when I look at my proximal box, this is axial wall, and your gingival seat should be horizontal to the tooth. It should be horizontal. It can't be like this, it can't be like this, it can't be like halfway. It has to be flat, as in flat. And all the other parts of the cavity should be well defined, should be recognizable, and should be smooth, and there should be no sharp points anywhere. How would you check it? Again, use your Explorer. This is not an Explorer, sorry guys, but you have that shepherd's hook Explorer. You just pass it through and then see if you hear a noise. If you pass it through and it is sharp, you will hear the click noise where you know it is very sharp, and then you reduce the speed of your high-speed handpiece to 40K, and then you slowly pass it through and like round it. If you're not comfortable using the burr to smooth the wall and you are afraid that you will damage the tooth structure, use an enamel hatchet and pass it through 2 strokes from buccal lingually and lingo-buccally, 2 strokes back and forth, and don't put a lot of pressure. So if you put a lot of pressure with an enamel hatchet, you will actually create a dent. Just shave it slowly, as if you're removing some backs. When you do the tooth carving, slowly scrape it so that you create that smooth line angles where they are not sharp anymore. Again, I have this is a famous questions with amalgam prep. They ask me a lot about retentive grooves. You have to provide retentive grooves. I will show you guys in my picture, like if they can see it clinically that if you place the retentive groove or not. and it is very small step to do, and it is very easy thing to do, and don't be afraid that you will damage the cavity, and I'll show you a picture how it looks like when you place the retentive group. And also use the half rounded burr. I'll go to the burrs and then explain the burrs again. And and again, smooth and rounded line angles, as I already explained.
Doctor,
So-
I have a question before we move forward.
Yes.
So regarding the gingival clearance, like we
Yes.
said that we need 1 millimeter of the height in the proximal box, as
Yes.
they mentioned, at least they said that it should be 1 millimeter.
Yes.
So I don't know where I'm going wrong, or is it just me? But no matter what I do, my gingival clearance in Kilgore is always more than 0.5. Like the proximal walls, I can get 0.25 to 0.35, but the gingival clearance is always more than 0.5.
So it has to be at least at 0.5. I don't know. So again, the mistake you're trying to do, I think you're doing is don't go deep all the way up in the beginning.
Okay.
So when you drop your burr, go with the minimum depth of it. So if I say
okay.
if I say 1 to 1.25 millimeters is the depth on the proximal box, I would do only 1 millimeter. I would do only 0.75 first.
Okay.
So I will drop that 0.75 and do not, again, remember when I talked about occlusal part of the cavity, I did not lift the burr anywhere. So once I drop that burr 7.75 or 1 millimeter, I will do not lift the burr, do not push the burr, do not tilt it, and then continue buccolingually, and then use the same height to create that box. Once you do that, break the thin layer of enamel you leave with your enamel hatchet, and then visualize if you have actually got the clearance yet.
Okay.
And I am 100% sure if you drop 0.75 to 1 millimeters, you will have already 0.25 millimeters of clearance on Kilgore, because I worked on Kilgore a lot and I taught a lot of students with Kilgore. So I'm confident that you will have 0.25 clearance already.
Okay.
But this always depends on your occlusal depth, what you created already.
Okay. Yes.
So, and also once you see that 0.25, you are good. You don't have to dig more. But with the burr, it is not always refined. You need an enamel hatchet to go there to refine it. And again, this is another mistake most of us do. Put pressure to rub around it, and we'll make it more deeper, and it will become more than 0.5. Always, enamel hatchet is very sharp, and it is an amazing instrument. Using it is also important, right? So if I see enamel hatchet go, dig, one scrape, buckle, dig, second scrape, done. Come back again to buckle side, dig, one scrape, air water syringe, see if you have clearance, see if your floor is smooth. Use your explorer always to pass it around, and then see if there is any sharp ends or if there is any bumps or something. And then again, if you see a small bump, focus on that bump. Do not go again from the beginning and scrape it. If you see a small bump in between, go to that bump and then just scrape the bump and then smoothen it. Do not go from the start again. If you do that, you're clearing the bump and you're creating 0.5 millimeters of clearance there, but you are creating more clearance, which will become 0.75 on the other end where you already did right. Does it make sense?
So much sense. Thank you so much.
Okay. So again, enamel hatchet, be very careful. Don't go crazy with it. It is very sharp instrument. Do not scrape it all the way as if I want it to be perfect. I want the walls to be straight, flat, neat, smooth. But do it right. Don't go crazy with it. Do two scrapes and check. If it is not enough, again, two scrapes, stop. If it's a small bump, only clear that bump. Do not do it from the scratch. Okay.
Okay. And one more question, doctor, regarding the proximal walls, in the box, you said that we don't have to tilt the burr and we don't have to undermine the walls, right?
Yes.
We do not have to make it convergent in there. We have to make it parallel.
Yes.
So if you remember,
let me correct you again. The parallel point or parallel concept applies to only axial wall.
Okay.
And convergence falls for buccal and lingual wall. Remember, see on the presentation I put as BL walls, buccolingual walls. Buccal and lingual walls of the box are convergent occlusally, which is very faint. But when I see from the lingual side of the cavity into the proximal box, your axial wall should be flat and straight. It cannot be divergent or convergent.
Got it.
Divergent, this is convergent, right? So it has to be flat. Axial wall flat, but buccal wall should be convergent occlusally. Lingual wall convergent occlusally. Does it make sense?
Yes, it does. Thank you so much.
Perfect. No worries. So again, this is your this is again, the credit goes to University of Buffalo. The source is from University of Buffalo. This picture, I'm disclosing that this picture has been taken from University of Buffalo's presentation, and they made sure that this presentation is available to all the bench invitees. So you guys are also have this, and there is no confidential disclosure for this picture. Just giving a heads up. Anyway, moving on. So the first 3 burrs are dedicated for amalgam preps, but honestly speaking, I only use 1/4 round burr from those 3 burrs. I don't use those 55 burr or 169 for amalgam preps. I know they are carbides. They're amazing burrs. But if you see 169, the burr is tapered. So when you try to cut the tooth, you are actually creating the taper and making divergent. So ideally, 169 burr is meant to be used on the if you are doing an MO, it is used on the occlusal distal part of the cavity to create the free end, dowtail end. But nobody understands that. And they use that burr all around, and they create the divergent wall, and they want to correct it at the end. They will use 220, 255 burr and come back to it, try to make it convergent, and they'll widen the cavity. Please don't do that mistake. Are you guys following?
Doctor, I have a quick question.
Yes.
So just in suppose if we have achieved the enough depth on the pulpal floor,
Yes.
but at the end we still see there's a burr mark.
Yes.
We see a burr mark on the floor.
Mhm.
So if I'm gonna clear that burr mark now, like at the end, my floor is gonna go more deep.
So
Is there
again, tip for it. The smallest end of the enamel hatchet is 1 millimeter. I would go with an enamel hatchet there and scrape it. I mean, the preparations I'm gonna show you guys also. If I see a small scratch of the burr or a small bump in it, I go with an enamel hatchet and like scrape that small part of it and make it smooth.
But sometimes I have seen like the burr, if the burr mark is 0.5 mm deep, it doesn't go with the in hatchet scraping.
Another tip for it, I would switch to 330 burr and reduce the speed of my handpiece to 40 to 25K and have more water in my flow, and then pass it slowly on that roughness. It'll be gone.
I have seen this thing like those stubborn burr marks. They doesn't go away. Like sometimes
reduce the speed of your burr or handpiece, and then use copious amount of water. It will clear it off.
Okay, doctor. Thank you.
Yeah. In the first place, again, do not reduce the water. Like, I mean, I know visibility is challenging when you're doing an upper maxillary. You are going like, okay, I can't see it. I'll give you guys a tip how to actually visualize better at the end of the presentation. But make sure you have enough water. Why? It is not a patient to reduce the heat, but because when you are using carbides, the flutes, or I think they are 18 flutes or 16 flutes, depends on the manufacturer of the burr. When they cut into the tooth, they remove the tooth material and they are still in the other flute when the burr is rotating. If you don't have enough water, they are not flushing out of the burr flutes, and you are creating the same cut material going and scraping onto the tooth structure which you are about to cut, and then that gives the scratches on the surface. So if you have enough water coming out, once you cut, the material is flushed out constantly, and then those small particles are flushed out. So when you're cutting, it gives you a smooth and flat cut. So do not reduce water in your bench test. They look for it because they smell it. They smell the plastic. And so make sure you have enough water so that in the first place, you don't You don't have those scratches. Good?
Doctor, I have a question.
Yes.
So they mentioned we don't need to bring any of our instrument, but is it okay if we bring our burrs or any other things?
You
or
will be
we are not-
disqualified if you bring anything from outside.
Okay. I just wanted to know that.
So what I would go with clean scrubs, your loops, and your presence of mind. That's all you have to bring.
Okay.
Good?
Yes.
Don't even think of getting even a phone or a pen or anything. They'll have everything for you, because their motto is to keep the because if you bring your own burr, that might be advantageous for you. That might not be advantageous for the other person. But they want to keep the results consistent in the bench. Does it make sense?
Yes.
Yeah. So don't bring anything. If they find something, you're out of the bench. Okay. Don't take anything with you. Not even anything. Okay. Again, continuing on to the bursts, as I mentioned, I would use 255 burr to do the proximal box of the cavity, and I would use 330 burr to do the occlusal part of the cavity for amalgam too. You guys heard me right. I always use 330 burr for occlusal part of the cavity and 255 burr to the proximal box of the cavity. I know they give only 2 burrs initially. If you use them up for amalgam, you can ask them, they'll give you a new burr again for your composite prep. So don't stress about it. If you guys are comfortable using 169, 556, I'm more than happy for you guys. But I would use 556 instead of 169 so that the walls are not going divergent. And moving on to the, okay, let me discuss quickly about this. You use the quarter round bar to create the retentive groove. And remember that retentive groove only falls on the proximal boxes line angles. So proximal box, you have axio-buccal line angle, axio-lingual line angle. So your retentive groove only is placed only on that line angle. And it shouldn't extend onto the gingival seat. It shouldn't extend on the occlusal part of the cavity. It should be only on that part of the axial wall. Okay, and I use a 1/4 round bar, a quarter round bar, and I place it in 45 degrees angulation this way. Let me see. Okay, the burr in this angulation, and then reduce the speed to 40K to 30K. No high speed. You can use. I mean, you're using the high speed handpiece, but you're reducing the speed to 20K or 40K, and slowly pass it from the top to the bottom once, bottom to the top once, and again go to the other side, and then use your explorer to see if you made enough dent there. If not, go back again for 1 stroke up and 1 stroke down, and you're done.
You said bottom to up or up to down?
It doesn't matter as far as you don't put more pressure.
Okay. Only 0.5.
Only 0.5? What do you mean
Yeah,
0.5?
like
There is no
0.5.
depth for the retentive groove. You are just giving a small scratch on
Okay.
that line angle, but it should be prominent enough that you can feel it with your explorer.
And you said nothing on the gingival floor.
No.
Oh, okay. This is very controversial because I've seen videos of them doing on the gingival floor as
So
well.
I will show you a picture actually to clear this up right now. Hold on.
Thank you.
Go back again. Okay.
And also, Doc, I would really appreciate, and especially for the class 2, if you can also share like you mentioned, the speed for the retentive grooves like 20 to 40K. If you can also mention the speed for like specific things, like if you're polishing or if you're refining the box, what speed should we go on?
Okay, I will answer those questions again too. Sure,
Thank
definitely.
you.
I had a PDF, so now I am coming back to the presentation, group meeting. So how can I share this PDF? Here. So share. Can you guys see this cartoon now? Yes. Can you guys see this cartoon? I mean, like the PDF which I'm sharing right now?
Yes.
Okay. So do you see in this picture on the side, this is my proximal box. I tried my best, guys. Don't judge the drawings.
You're good.
So again, see, this is my axial wall, right? And this is my buccal wall, and this is my lingual wall of the proximal box. So my retentive groove is only following from the depth of this line angle to the height of this line angle. It is not gonna fall on my gingival seat anywhere. I mean, it will touch the gingival seat. Like if this is the floor of gingiva, this is the wall, it will start from that point angle, but it will continue to the line angle up. It won't go onto the gingival seat. Does it make sense? Anyone? No?
Could you please explain it again?
Sure. So the retentive groove is falling on the axio-buccal line angle and axio-lingual line angle. So you see the buccal wall is going and touching the axial wall, and then lingual wall going to the axial wall, and they create a line angle, right? So and your retentive groove is only falling on this line angle, which is axio-lingual, axio-buccal. But where does it start? It starts at the gingivo-axial buccal point angle.
Got you. Okay.
Does it make sense, guys?
Mm-hmm.
It
Yes,
starts at
doctor,
the point angle, goes all the way towards the occlusal part of it. That point angle continues on the line angle and goes all the way to the top. I think now you guys understood what I was talking about, right?
And top to the pulpal floor, right?
Yes.
Yes.
But do not go off the pulpal floor. It is just at the pulpal floor.
Got it.
Okay, good. So I'll come to this picture again. I just wanted to make it clear for you guys to understand this. Again, share something else. Windows, presentation, share. You guys can see the presentation again, right? Okay. Thank you. So we talked about the burrs and moving on to the amalgam restoration. This will be quick, guys. Don't sorry for if I'm being a lot of detailed about stuff. I could talk all day long anyway. So continuing to amalgam restoration. These are you guys know how to do the amalgam restoration. These are the brief points that you definitely have to keep that in mind. So I put the dead tooth on the left because amalgam is almost extinct now. I am so sad because amalgam is an amazing restorative material, but it's been off the grid because even Europe actually they don't have it in the standard guide anymore. They don't use amalgam anymore. It is actually banned in Europe to use amalgam. That's very unfortunate. So I put a dead tooth as a representation of that. Anyway, continuing on. You have your band put on your Tafelmayer. And then before you put it onto the Tafelmayer, I want you guys to take the Tafelmayer matrix band, use your burnisher, and then use your thumb, put it in between, scrape it, and make sure it coils down. Scrape it, coils down. So that you are creating that burnishing effect or bending of that matrix band towards the contour of your proximal surface. If not, if you don't do that, it will just be like a flat thing. And then you try to burnish it inside and it won't work. And still you will have overhang on the mesial part, I mean on the lingual and buccal points of the cavity. Buccal and lingual part of your proximal box of the restoration. So make sure you, okay, let's say this is our matrix band. Do this so that it coils down, and then you put it onto the Tafelmayer retainer. And then again, this mistake, a lot of people does it, and then again they have to switch it and do it. Remember, when you put it onto the Tafelmayer, the the Toffelmeier loop which you create on the Toffelmeier will have, it looks like a triangle. It looks like a triangle, and then the base should go occlusally. The widest opening of that band should go occlusally. And then the thinnest or narrowest side of that loop which you create with the band should go gingivally. And again, once you place that matrix band, you have your wedge lingually or buccally. Once you put that in, make sure go with your explorer into the cavity and see if you have open margins on the gingival seat. By the gingival seat, if you see so, and if you see that embrasure is visible, you put another wedge. You can, I guess you guys know double wedging technique. You can do this or do this, double wedge buccally and lingually, and make sure you have that tight contact. Again, if you are double wedging, there should be medium sized wedges so that they can overlap. If you use large wedge and large wedge, you are creating actually open margin. So keep that in mind when you're double wedging. Use medium wedges. They'll give you all the sizes of wedges. So use medium so that you can double wedge, or use just a large so that make sure you don't have any space created there. And before you put your wedge on, once you burnish the band initially and put it on, use your ball burnisher. Use your ball burnisher before you wedge it. Make sure you burnish inside the cavity. This is your proximal box. This is your band. You put your burnisher there and burnish it inside so it adapts around it, and then put a wedge. Again, burnish it once or twice so that you create that contour, smooth, sleek contour around, so that it doesn't create that boxy amalgam on the side of it. And moving on, and you guys know how to triturate the amalgam, how to carry it, and then bring it into the cavity. These are something basics. I don't know if you guys want me to go through it, but I'll give you guys a heads up. Sorry, I can't see messages, guys. Again, just wanted to tell you. If you are raising the hand on the presentation, I'm not able to see that. I am gonna request you guys to unmute and talk to me so that I can talk to you guys right away and explain it. I think Rachna Nivas raised a hand. Do you have any question, dear?
I didn't want to disturb you, so I raised the hand. I just want to ask you, because they provided in the PDF, are they going to provide the Omni Matrix as well, the Ultra Dead product?
They will give you that too.
Okay. Apart from the Toffelmeier?
Apart from the Toffelmeier, yes.
Okay.
You can use both of them as per whatever you're comfortable with. But with me, I think Toffelmeier with a matrix band is more easy to adjust it, adapt it, and then burnish it so we can get a nice contour.
Sure. Thank you, Doc.
No worries. And coming on to the next part, as I mentioned, they will give you, I was talking about the amalgam, sorry. So they usually ask you, once you put your matrix band and wedges, and when you're ready to put amalgam in, you have to tell one of the TAs who are walking around and tell them that I'm ready for amalgam. And they will go triturate 2 capsules for you and bring and crack the capsule and put it in the amalgam well for you. So you don't have to rush around for it. So they'll crack and put it in the well so that you can use your amalgam carrier, take the amalgam carrier, take the amalgam, dispense into it, condense it. Do not dump a lot of amalgam at the beginning. Put a little bit at a time and then condense it really well. Start from the proximal box, condense well and to the occlusal part of it. And then always overfill it initially so that you can take off the amalgam. And this is another very, 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 very important thing, which most of us probably know, probably not know. So once you create that proximal marginal ridge on the distal or mesial, whatever the cavity they give you, once you create that, use your explorer to bend towards you and pass it along the exterior wall of the restoration. So you create that inward marginal ridge instead of having a divergent open marginal ridge. So again, if it looks like this, you finished all your carving, it looks like this, you use your explorer before it sets and then remove it according to the axis of the tooth, according to the contour of the tooth, so that it creates that bend and inward motion. inward shape or anatomy towards the restoration, or inwards the tooth. And again, this is one more important thing. When you are this is not a Holland bag, guys, sorry, this is a Holland bag. So when you are carving, we are always targeted into carving the anatomy on the amalgam. This is something a lot of people does. I mean, maybe not you guys, don't take it for offense, but anyway, this is the huge important thing. When you carve amalgam, make sure 30 to 40% of your blade is oriented on the tooth structure, not on the amalgam. So see the blade, the blade starts here at the shank, right? And then the tip of the blade is here. The shank half of the blade should be on the tooth structure. And then the tip of the blade should be on the amalgam. And then once you scrape it along the cavo surface margin of the tooth structure, it gives you the stability of the blade on the tooth surface, and you're removing the amalgam all around. And then automatically you're creating no flash, and there will be no excess material because you're following the anatomy or cavo surface margin of the cavity. So it will follow, and then you are removing that amalgam in the depth of the filling. So it will follow the anatomy too, and you don't have to worry about like creating anatomy, scraping, giving lines and blah blah blah. So if you follow and make sure the tip of the blade is falling in the mid part of your cavity, mid part of your restoration, and then half of it is on the cavo surface margin, you pass it all along, and then you are creating, actually according to the anatomy of the existing tooth, you're creating those pit and fissures, and also creating the cuspal inclines of the restoration parallelly or as parallelly along with the cavo surface margin of your existing anatomy.
Doctor, do we need to restore the proper anatomy?
Yes.
Okay.
That's the whole point of doing a restoration, right?
Yeah, and when the band is placed at the tooth, sometimes I feel it challenging while working with the Holland bag.
You could still do it, but if you are not comfortable using Holland bag, the instrument or the other instrument is cleoid discoid. They will always have that instrument too, and you can use that instrument because it has shorter blade, so that you can go into the band and do it. Again, if you position your matrix band in the right position, it will not interfere you to carve, because if you don't see the gingival matrix band all the way down to the gingival margin, you will have length of the band going up on the top, which will actually interfere you to carve it. But if
the
you
thing is the marginal ridge.
Sorry?
When I'm taking band low, so I won't be able to maintain the marginal ridge.
Okay. So that's a challenge, but you have to find the right balance again.
Yeah.
Sorry, but I don't have a better answer for it, but you have to find that balance of having it in a way that you position it so that you have the room to go make the marginal ridge too. Again, on the marginal ridge, do not go hard on it and then put more pressure on it and you'll crack it, because amalgam is still soft and it's still hardening. So you don't put pressure. So if you break it, you can't attach it back again. You have to remove it, drill out the cavity or drill out the filling, and then redo entire thing, which will take a lot of time. So be very careful when you're doing proximal. So, and again, you have the adjacent tooth which is not prepped, because remember, in bench they will usually give mandibular premolar for your composite and mandibular molar for amalgam, as far as I remember. Correct me if I'm not wrong. Correct me if I'm wrong, sorry. And you will have the adjacent tooth which looks the same, obviously, right? So you can use that anatomy as characteristic features to try to replicate it on this. But again, this is very important. You follow the cavo surface margin of the existing tooth structure, maintain the 40% of the blade on the tooth structure so you can create that anatomy on it. And again, remember that Explorer, use it on the proximal surface. Around, you see the band here and you see the material here, amalgam material here. Use the Explorer to by the band create that loop so that it comes inward, and you remove all the excess material around it. Do not leave excess on it. Once you do that, make sure you burnish it smoothly. Don't put a lot of pressure. When you put a lot of pressure, you are actually pushing the amalgam more and condensing it in more, which will actually create the open margins on the KO surface. So if you push it more and then rub it out, and then you are pushing the pressure, slowly it will condense down, and then you will have the dent there, and you will be in trouble to, like, create it again. You remove it and put it back again. So be careful, gently burnish it, don't put more pressure on it. And once you do that, you start to hear that creak noise, amalgam cry, as you know, and then loosen up your Toffelmeyer. Do not remove the entire apparatus together. Take the Toffel retainer out, and then take the band out from one side of it where there is no cavity. Take it out, and then where there is marginal ridge, which you created right now, slide out, slide in, and try to give gentle upward pressure when you're doing that, and then remove it slowly. Do not pull it out. Do not pull it out linearly, or do not pull it up loosely all the way. It will crack it down. It happened to me a couple of times when I did pin written amalgams. I wasted my 2 hours of all the hard work of carving. So make sure you do this motion, slow back and forth, and slide it up and then take it out. Okay. And again, I heard a couple of people started to use Vaseline to slide it out. You will get Vaseline. They'll give you if you want it, but do not think of using it. You are messing around, because if you apply Vaseline in before you condensing it, you're creating that wavy dent. I heard a couple of students, they did it. I was like, okay, God bless you. You got it right, but do not do it. You will have dents or air voids in the amalgam where you condense on the proximal. Be confident, slowly, slightly slide it off. And then always use your explorer. Once you finish it, this is your proximal cavity if you created. Use your explorer to go on the sides and see if you have any overhangs. If so, do not go this way sharp. If this is your explorer, go onto the proximal surface and then see if you have any overhang. Slowly slide it up and then see if there is anything which will scrape up and come out, and be very gentle so that you don't crack your proximal box which you created already. And on the occlusal part, slide it onto the amalgam towards the KO surface margin. See if you have any open margins or flash. If you so, use your explorer again to remove it. Do not use carver again, which you create more scratches on it. So use your explorer to just remove the excess flash if you have, and then make sure you check there are no open margins. And gently, again, I mentioned it here, gently burnish it, right? And check the KO surface margins very gently too. And this is the fun part.
Doctor, sometimes there is like, I find when I do amalgam filling, at the very end there is little bit a kind of void at close to the KO surface margin.
Yes.
So, like, if that happens, do we need to repeat all the filling?
No, you don't have to. So I have a trick for you. So if you have the amalgam already placed here, if you see a minute open margin on the KO surface margin here, wherever the point is, use your ball burnisher, put pressure on the amalgam material at the deepest point, and then push it towards the KO surface margin, so it will slowly adapt towards that KO surface margin before it completely sets.
Right.
So if you have that open margin here, only at that point, do not try to spread the material here, which you make it more deeper, but start spreading the material from the deepest point and put pressure on it and slowly push it from here. So it will slowly adapt towards it. Once it starts moving slowly and adaptive, then you can put more pressure and try to cover it off.
Thank you, Doctor. Can you go back to previous slide again, please?
Sure.
Sorry, I did not get a chance to read the slide.
But the presentation will be recorded, and you will have a copy of it eventually as soon as possible. This is done, and then you can go through it, and at your time you can read through the slides too. So that actually, I hope you're not running late. But anyway, again, so for amalgam again, guys, B10 condenser is more than enough. I don't use B12. B10 has the smallest round where you can make sure your base is completely condensed into it. And then on the occlusal part of it, I switched to B12 so that it is more easy and faster on the occlusal part. But in the deepest part of the cavity, make sure you use B10 so you condense the amalgam first. Remember again, they just not check, they won't just check the amalgam restoration on the model. They unscrew it. They unscrew it, take it out, and see the sides of it to see if you have any overhangs or open margins on the proximal box too. So be very, very mindful when you condense the amalgam. Make sure you use the smallest part of it and like put pressure and small layers, deep condensing from the bottom so that you don't have any voids on it. Good. And you can use stuffed carver and clayoid, discoid, and hole and back for amalgam and slowly adapt them and carve them, and then use the ball burnisher. When you are using the ball burnisher, use the smallest burnisher. Do not go with the biggest one. Okay. And
Doctor,
yes.
Doctor, for the you told about the retainer, so we need to remove the retainer once everything is set. That's what you said, right?
Yeah, once you hear the cry, you have to hear the cry before you take it out.
Okay, got it. Everything like proximal and occlusal, once everything is done.
Everything, and even the proximal, I told you, right? Matrix band and the marginal ridge. You once you finish the carving, I always use the hole and peck on the side to create that, like, loop of that marginal ridge. And then I will use my proximal, my shepherd explorer, and then create that clearance so that there is less contact to it. It makes it easy to remove it. And then once you start hearing the cry with the burnishing, and then you can take it out.
Got it.
Doctor,
Yeah. Thank you.
Yes.
while I'm practicing, I'm using dental floss for the proximal clearance. So do they provide floss if we ask?
They do provide floss. As I told you again, you'll have everything that you can ask for. Even if you don't have that, you can ask and they would deny, or they would say, there you go. They're very helpful. Most of the TAs who will help you in the bench are all D4 students, and they are extremely nice and helpful. Don't worry about it. And you will get floss. And when you are doing floss, like, do not do it early. If you have your burnishing of the band right, your floss will go in and out perfectly with a click out. But if you don't burnish the band properly, your floss will not go in and out, and you will be in big trouble, right? So for composite, you can trim it down, or you can do something, but amalgam, you can't do anything. You cannot trim it, right? So make sure you pass that explorer before it sets on the sides of it, and then make sure you condense properly. Make sure you burnish the band properly. Okay.
Okay, doctor. Thank you.
Okay. So coming on to the composite prep, because these are all basics what I'm trying to explain. So it took longer for amalgam. So composite will go faster.
Yeah, doctor, one question before we move quickly.
Yes.
So
yes.
what do you suggest? Like, is there anything other than ball burnisher to make it smooth and shiny before you finish off the prep?
You really don't have to make it shiny. To be honest with you, they expect you to have clean anatomy. They don't expect you to make it shiny.
Okay.
That was my question, because is it mandatory to use ball burnisher, because we use it for the polishing mostly? So
yes,
is it okay if we just go with the carving and finish our restoration? And
so again, if you don't like to use burnisher, I would recommend, the applicator tips you get for your bonding material for composite restoration. I usually even after my burnishing, I see some dust here and there, blah blah blah, right? So what I go is I take that applicator tip and then brush it on the top slowly so that it becomes smooth and it is not shiny it doesn't create few shiny lines here and like dull area here, so it be uniform. Once it starts crying, I use that applicator tip to just brush it on top of it, so it creates that uniform display, so it is pleasing when they look at it. And then go with burnishing if I have to. If I don't have to do burnishing and my carving is perfect, and then I don't have deep sharp points anywhere, I'm totally good. I won't use burnisher too. It all depends on how you carve it, right?
Okay, one last question. How much working time approximately we will get with the amalgam that they'll provide? Any
So the
idea?
amalgam they provide is slow set. It is not medium set or fast set. You will have all the time in the world to finish the carving. You will be like tired, okay? And also, when I did it, I finished my carving. I did not start crying. So I mean, did not start studying. So I continued with my composite prep. I went back into composite. I put my Palo mattress system, and then started to do everything. I arranged everything for it. Then it started to set. Then I came back here and then finished my burnishing and then removed the band. So you will have enough time. Don't stress about it. But you have to be quick too. Remember, you can't be like, oh, it will set forever. Don't have that attitude, but try to get it done as soon as possible. But do it right. Don't rush yourself. If you rush yourself, you're making more mistakes.
And you recommend doing the restorations first or the preps first?
Preps first.
Really? I was
Preps.
thinking it will be all neat and clean before we start. So maybe get done with the restorations.
Okay, I have another thing which you forgot. So once you finish your amalgam prep and you go back to your crown prep or like cavity preps, the water is pooling in the oral cavity, and your amalgam will actually change in color with constant water touch.
Oh.
Yeah, and it can crumble too because it's still setting.
Oh, so you recommend doing the amalgam at the very end?
Amalgam and composite at the very end for the
okay.
Yeah. So yeah, don't
Thank
even.
you. Thank God that I asked, because I was thinking to do restoration and get done with it.
I know. I mean, these few things we don't think, but it actually makes a difference, right?
Yeah.
So I would say do your class 2 cavity of amalgam first, class 2 cavity of your composite second, and then crown prep, and then go for composite, and then do amalgam. Or amalgam and composite can go vice versa. It's totally fine.
Okay.
It's not a big deal. Yeah.
Okay.
And no worries. So composite preparation, guys, I'll be quick into this because it's not very complicated. It's pretty easy. I'm going to start the slideshow again. Okay. So again, 4 or 13, remember it can be any tooth. Remember it is a premolar. I promise it will be maxillary premolar. I'm not sure if it is a right or a left. Again, I will use 255 burrs and 330 burrs for this. And you guys know how to do a composite prep, but there are two things very, very important. Again, pits and grooves included, and they should be centered cavity, labiolingually 1 millimeter to 1.25 millimeters. The exit angles are the same, and but the difference between amalgam prep and composite prep is that your walls are straight 90 degrees. Know this. See, I wrote it here on the proximal internal form, says parallel occlusally. Parallel occlusally, 100%. Do not create that, which is not a conservative prep again. And the depth is almost the same, but here, when I say amalgam, it is 1.75 to 2, but here it is 1.5 to 2. Guess what? I'll keep only 175. The maximum is I could go is 175 because composite doesn't need enough depth to survive in the oral cavity, right? So I always keep my range between 1.5 to 1.75 so that when I'm finishing the cavity, if I have to trim it more, if I have to make the floor smooth, if I go to 2 millimeters and if I try to smooth the floor, I'm going to 2.25 millimeters, which is a critical error for composite prep. So make sure you make 1.5 so that if you have to make any changes or corrections, you will make it more deeper here and there. But make sure it is 1.5 in the deepest point of the cavity and 1.75 in the highest point of the cavity. And again, the buccolingual walls are straight. The axial wall is straight. No this and that. Make sure it is parallel to the long axis. And the convexity continues again. Remember, I mentioned you guys pulp. Again, it has to continue the convex, but it don't have to be sharp ending into the buccal wall or sharp ending into the lingual wall. It has to be a smooth blending because of composite doesn't like sharp ends. So you can just merge it into a S wave or a bow. I will show you a picture where I have a better picture for it to make it more easy for you guys to understand it. Again, the proximal box is the same. The depth is the same, as conservative as possible. and then make sure your exit angles or exit clearances are 0.25 or 0.5 millimeters, not more than that. The gingival seat is the same, buccals is the same, lingual is the same, but the major another difference is that your exit angles into buccal and lingual should be divergent, not 90 degrees. I have a picture for it. I'll show you guys again. So it shouldn't be 90 degrees exit. It has to be a divergent exit because of the undermining enamel, which will fracture or have secondary caries eventually. And internal angles and point angles and line angles all should be smooth. And very, 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 very important and crucial thing, creating a gingival bevel. Many people ask me, do we have to create gingival bevel? Yes, you have to. Okay, I'll show you a picture how to, let me show that before I continue. Sorry, guys. So that
Doctor, before we move on, which bird do you suggest using for the gingival bevel?
So I usually use okay, let me show the picture of it. Can you see the burr block now? Share. Can you see the burr block? Yes.
Yes.
So you see the pointed burr, which is called interproximal burr, a diamond they give us.
What is that number?
Let me see. Hold on.
Because it's very small, I cannot see.
Let me make it big. Can you see this now? Better?
The first one you said, right? On
the first one at the front, 850-012 interproximal burr.
850-012, okay.
And also you can use a flame burr.
If they provide, I
They
doubt.
do provide this. They do provide this.
Oh, okay, okay.
And I can use that interproximal burr because it is longer. So I can access the seat of that gingival seat and then not to touch anything else in the cavity. I can touch that slowly back and forth with 40K speed and slow.
Okay.
And if you're not comfortable using burr and you know that you'll mess up, your go-to is GMT or enamel hatchet. If you don't have a GMT, I don't remember the GMT. I have no clue. Anyway, so if you can use enamel hatchet, the enamel hatchet is a standard instrument. It will be there always. So enamel hatchet blade is flat, right? So you tilt the enamel hatchet, position it, and then scrape 1, 2, 3, 1, 2, 3, done.
Okay.
Good?
Yeah.
Okay, let me show you this picture before I continue so that you guys know what I'm talking about. Window.
Also, Doc, we couldn't see the picture for the composite criteria. I think you forgot to display that. Can you display it?
I am going there. That's what I'm trying to look for.
Oh, okay.
Sorry. I think I kept it open. And now you open minimize it. Now scroll down. There you go. Sorry guys, I'm extremely poor at this thing. I'm trying my best.
No, you're good.
Especially technology. Oh boy.
I think that's most of our medical and dental students.
Yeah. So I don't see. Okay, let me do the entire screen so that it makes it easy, I guess. Hold on, share. Okay. Can you guys see this now? It's a cartoon.
Yes.
Okay.
Yes.
So
Yeah.
This is my amalgam which I was talking about, right? Again, I'll briefly go through this before we continue to composite restoration. Do you see this oblique ridge? You cannot touch that oblique ridge. You can go into the cuspal inclination or inclination of your oblique ridge. For amalgam prep, guys, again, this is amalgam. You can go into it, but you have to make sure you can go only 1/3 of it. 1/3 of that inclination can be included in your cavity, but make sure your pit will be here. So this will continue here, right? So you can, this is your pit, right? And then you can include this in the cavity. And make sure you don't do this dovetail like this on this place and you're undermining this cuspal incline. Don't do that. And make sure you just trim this a little bit and then go straight and then slide and then go into 90 degrees exit. Again, slide down and then go into the 90 degrees exit. Because on the buccal side, it will go wider because you have to have that clearance here, right? So, and again, your proximal box should be equal length on all buccolingual direction, and your exit angles are 90 degrees, and your retentive grooves are on that point line angle which I mentioned earlier, and which will go all the way to the top. And coming to the composite prep, so see, there is no dovetail here. So here is my pit, and you are just including that pit and fissure. That's it. You're not going into here, or you're not going into here for composite, because it is extremely conservative and they love this. They don't like you guys making that dovetails here and there for composite prep. You're just including that and coming back and then exiting in a divergent way. You're not creating that 90 degrees. You don't have to create that 90 degrees, and then your box goes out. And then your axial wall, see the difference between the axial wall is straight like this, and it is going convex, still have that curvature. But here, it still has the curvature in the 90% of the axial wall, but still it blends in. It doesn't create that sharp end. Does it make sense, guys? No? Maybe, maybe not. Anybody?
I think you're trying to say that for composite, the internal line angles do not need to be sharp,
Yes.
and in amalgam, they need to be sharp.
Yeah, they need to be confined or defined.
Okay, got
So,
it.
so
They are not sharp in
basically-
amalgam too. They are defined well, so that we have equal thickness of amalgam in both buccal and lingual ends of it.
Yeah,
I
makes
think,
Questions?
sorry.
Anybody else?
Sorry, Doc. Yeah, I am a little bit confused about what you said right now. Is that what you are mentioning about axiopulpal bevel, or just we need to?
Can you see my hand clearly?
Yeah. Mm-hmm.
So this is your axial wall.
Okay.
So axial wall is going in a curve, right? Convex from buccolingually. And it is more defined in amalgam. So look at me as an axial wall, and look at this as an axial wall. I'm trying to explain this in 3-dimensional. I don't know how to do that. But anyway, so see, for amalgam, from buccal end, it is going all the way to the lingual end, like this. But for composite, it is smoothly merging into the wall and coming out and going into the wall. So it has to be like slowly merging into the wall. It cannot be sharp merge.
Got it. Got it. Yeah.
So that if you have a sharp merge, it is not acceptable. But don't make it very obvious. But try still to keep the gingival seat equally. But just wall shouldn't be like sharp. Don't use your enamel hatchet a lot there to create that sharp ditch, and which will be in a problem again. It's not a criteria, but it is like important to have that smooth wall.
Yeah. How can we make that smooth edge? Is it?
So with burr, once you create that wall with the burr there, do not go back with enamel hatchet with the end of the blade. You can use the blade on the floor. Do not touch the blade all the way towards the axial wall, which will create the sharp end there. So on the ends of that line angles, do not touch the blade. Just put the blade on the floor and smooth the floor and merge into the wall. Does it make sense? I'll show you some preps. Maybe it'll make more sense when you see the prep differences between. I have a picture of both amalgam and composite both next to each other, so you guys can appreciate the difference, I guess.
Okay, got it.
Okay, and also the gingival seat, guys. Remember, I just put small lines here, which is the bevel which we are supposed to create. Only on the edge. It doesn't have to be like half of the gingival seat. It has to be only 15 to 20%, 15 to 20%, 15 to 20% of the gingival seat. I see people make it like this, half of it into the bevel. You don't have to create that obvious bevel. Okay.
Also talk about the, I don't know if I missed it, but did we talk about the axiopulpal bevel that we make?
Axiopulpal bevel, you really don't have to make it.
Really?
You really don't have to make it, as far as you keep it smooth. So if you make the bevel, we try to make it more obvious. Let's say this is your axiopulpal line angle, right?
Mm-hmm.
Amalgam, you are just smoothing it. Like you make sure it is not sharp. For composite, you make it is sharp. It is not sharp too. But you don't make it obvious that you are creating this wedge. If you create this wedge, you are creating sharp line again here, and you are creating sharp line here again. And we were not, it was not a, it is not something they expect you to do, but it is not a recommended thing to. It is something good to have. That's kind of attitude they have. You know what I mean?
Yeah.
But what I personally did to make that obvious difference is in this wall, I always keep this smooth for both of them, period. But for composite, I just use that enamel hatchet to just scrape 1 or 2 layers to see obvious. That is not in the grading criteria, so you don't have to really worry about it. Does it make sense? Anybody? Okay. So if you try to make it more obvious and create that axiopulpal wall bevel, and if you create more depth or a dent, it is a critical error than not having it and just have a smooth line angles. And your grading criteria will say to have smooth internal form and line angles and point angles. Done. Don't worry about it too much. Good. And moving on to the presentation. Let me. So we are gonna discuss quickly about payload end. You guys know, why did the T come down? Okay, anyway. So the payload end is available for you guys to use it. You are more than welcome to use another additional matrix band and do the composite with the matrix band, but this is nice and easy to do. You just position the matrix band and then loop and then the wedge. And then with this, you really don't have to burnish it, but I personally burnish it. How? Once you place everything, all the setup in shape, I use the ball burnisher to go in the proximal box of the cavity, and I'll rub it around against the next additional adjacent tooth so that it is completely adapted to it, so that I don't have any open margins. And if you do the restoration right, you don't have to do a lot of trimming with composite. So keep that in mind. And the sequence again, burnish the band after placing the sectional. Remember, put the sectional and then band, ring, wedge, or band, wedge, and ring. But ideally, it is better to do band, ring, and then the wedge so that the band doesn't move when you try to wedge it. And select the right wedge. So if you go back to this, remember guys, there are so many types of wedges in this, but the usual wedge which will help you guys the most is the blue one, the mid-size one, not the dark purple or the light blue. But before you do anything, remember the models are like go through wear and tear. The rubber at the bottom is like smooth and soft. It can go bad and it might not fit in. Before you put the band in, make sure you take a wedge and then position and see if it will fit exactly the embrasure. And then see if it fits the embrasure, and then once it fits in, take the wedge out and then put the band in, or check with the other wedges which fits better, and then put the matrix band, ring, and then position the wedge back in. And then use the Explorer to see if there are any open margins by the seat. If there are no open margins, well and good. Use your burnisher to smoothen it inside or burnish it inside, and then start with your you don't have to etch, as you guys know, because it's just the dental model. So you just put the bonding material and then make sure you don't have a lot of bonding material. Just touch the bonding material around and then air blow it, not heavy air, light air blow, and make sure you equally spread the layer of your bonding material, cure it for 1 round for 20 seconds, and then put it back on, and then start filling the composite. Again, it is very, 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 very important to do the composite in layers. Do not build everything in 1 shot or 2 shots. Make sure you have at least 2 layers on the proximal box, and then 2 layers or 3 layers on the occlusal part, and by the merging point on the extension of your restoration, make sure you have decent amount of it so that you can carve it. Again, this is another thing habitual for us, because the composites in buffalo are very sensitive to light. Very sensitive to light. If you have composite open and if you leave it on the counter with the open light, it sets in no time. So be very, 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 very mindful when you take the composite out from the gun onto the PFI, close the cap and put it back on. Put it back. And then put the composite in, adapt it. Before you even open the capsule of bond or open the capsule of composite, make sure you turn on your yellow safe light. And you guys have got a presentation of webinar from the school already. They would have mentioned how to change the light on it, and it is dead easy. You just click onto the light. There will be up and down buttons, and it will change to yellow safe light. Make sure you change it to yellow safe light before even you crack open anything related to composite. And I'm gonna emphasize it again, yellow safe light first. I know you will be so stressed out, like, I mean, this is the last task, I have to get it done, blah, blah, blah. Do not forget it. If it sets halfway and you have to dig back in, you are wasting your time. And continuing, and again, it is the same. I use cleoid or discoid to adapt my composite. And also coming back to the instruments, you see the instrument called Loma Linda. So this is a contra angle PFI. Basically, it has a bend in the shank, bend from the shank, and also bends this way. So it have that contralateral angle of the blade, which is actually a PFI, and it is very, very, very useful to adapt the composite towards the KO surface margins before you trim it. I know everybody will say, like, dump it in, cure it, and then trim it as you go. But when you're trying to trim it, there are many chances that you can trim actually a tooth structure too. So make sure you remove all the flash before you set. Make sure remove all the flash. Make sure you create that anatomy, and then remove the once you cure it, then you can think about trimming it depending on how you cure it. But make sure you avoid trimming. Probably you don't have to trim if you do an amazing anatomy with your PFIs. So I recommend using cleoid discoid to adapt the material, and also you can use the basic plastic filling instrument and also Loma Linda to adapt it on the cuspal inclinations. And last but not least, with the composite restoration, there is this instrument called cord packer Balshi, the B cord packer. We in rush by mistake use this instrument for composite adaptation, you will be in big trouble. So this cord packer will have rough end at the tip of the blade, like, you know, the PFI. So the blade extension will have small dents at the tip so that you can push the cord into the gingival sulcus. That's the reason the cord packer is, and do not get confused with between PFI and cord packer. I know I picked up cord packer instead of PFI because they are always adjacent to each other. So this is the cassette setup, and this will be the same cassette setup with everybody in the school. Even we get the same cassette for the restoration. And then at times I picked up cord packer and it's like, why does the composite doesn't adapt properly? And then I see, oh, I picked the cord packer. So don't do that mistake. So your composite will not sit in properly. It keeps bumping up, and you create air voids inside if you use the cord packer, and be careful not to use that. And again, make sure you use your explorer, pass it on the proximal surfaces, and then see if you have any flash. Once you take it out, if you have any flash, because you cannot put burr in the proximal surfaces, they will give you a BP blade to cut your putty. We'll get there in a minute. So use that BP blade to remove the composite on the sides. I have a picture for it. Again, let me show you. See, you can adapt the blade adjacent to the proximal surface, and then lift it up, slowly scrape it on the surface. Do not be hard on it, gently, and then you can remove the excess flash on the proximal surface. And again, on the occlusal part, make sure you check the margin adaptation with your explorer. Make sure before you cure it, use your explorer on the marginal ridge to adapt and create that smooth finish towards inward towards your creating the marginal ridge when you're creating the marginal ridge, and then cure it. Do not cure it with like flat edge and try to trim it. When you're trying to trim it, remember we have a habit of trimming the tooth, which is harder to cut, but composite is smoother to cut. So you have that habit of trimming the tooth and the same force and same pressure on your finger, and then you are trimming a lot of composite, and then you'll be ending up having less height of your marginal ridge, and then you'll be like rebuilding it again. So make sure you position your probe, perio probe flat between both the marginal ridges from the adjacent tooth, and see if the marginal ridge is flat and following the same height of your adjacent tooth, which is very, very important. No too much, no less. It has to be flat like this next to each other. And moving on with this is very, very important. Again, guys, you guys might get discs to use. Do not even think of using discs on the composite preps on the posterior teeth, because discs are designated for the anterior teeth. Again, I'm repeating, discs, soft flex discs are used only for anterior finishing of your composite, not for the proximal, for the posteriors. If you do use it, you are removing excess material in the anatomy which you existingly created, and your proximal ridge will be worn down when you are using disc, and you have really hard time using the disc when you are using it on the posteriors. And again, use your dark purple points first, and then light purple points. I would usually use the cones and the discs of this set. I usually don't use the cup, but make sure you have copious amount of water. This goes on the slow speed handpiece, and you can reduce it to 20K or 40K speed. Usually the max is 40K. You can reduce it to 30 or 20K, and then like use a lot of water to smooth and polish the composite. And I showed you guys this slide. Use the BP blade to trim down the proximal composite. If you see any overhang, if you don't see overhang, don't go with the BP blade there. And again,
Doc, I have a question.
yes.
What's the ideal curing time for this composite?
There is no ideal curing time, but I would recommend every layer to be cured for 20 seconds.
And Doc, one more
Final cure will
question.
be 40 seconds at least.
Okay. I have one more question. When I'm
Yes.
using this Explorer in a proximal area while removing or creating an inward margin, it creates like visible contact.
Because you are pushing the probe too deep.
Okay.
You know what I mean?
Yeah.
So if this is your band, if this is your material, you are putting your probe only till here, the tip of it, to create that bend. If you push it more, you're creating the open contact.
Yeah.
And before you, once you are done with your polishing, blah, 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 make sure you put your floss and check. And one thing in rush we forget to do. Can anybody tell me what it is?
The flossing.
Nope, after that. No? Okay.
Contact.
Occlusal check. Yes, contact check.
Yeah.
Because we are so in a rush to get everything done, right? So we forget that they'll give you a piece of articulating paper. There will be articulating forceps. So you can use that and tap, tap, tap. And then lateral exclusions are impossible in our model. So just to tap, tap, tap at least 2 to 3 times, check it again, and make sure there are no high contact points. And you will have minimum contact points in 3 or 4 spots. Usually 2 points in the lingual and 3 points on the buccal. Usually, if all the contact points are in the same density of visibility, you're fine. If you have 1 point which is high contact density of that material, of that color coding, then you trim it down. But be careful when you are trimming the composite. Make sure your burr is angulated along with the KO surface margin of the existing tooth structure. That is very, very important. If you tilt your burr too much, you are making a scratch in the composite, right? And this is pretty easy. Crown preps are something, the easiest task, I believe. There are very, very few important things that you have to remember in the crown preps. So this is something everybody said, like, no, it can't be true. but it is true that according to our grading criteria, it is 1.5 incisal clearance, not 2 millimeters for ACC. Sorry, I wrote it as amalgam prep here. Maybe I missed to change this. My bad. It is a all ceramic crown prep. I'm so sorry about that. But anyway, so this is for the crown prep. Again, this is 1.5 millimeters incisal clearance for ACC and 1 millimeter labial clearance and lingual clearance or palatal and 1 millimeter clearance by the cingulum too. We are so focused on the labial surface to get 1 millimeter, but we forget that we still have to have clearance by the cingulum area and also maintain the height of the cingulum. I will show you guys picture that what you guys are what I'm trying to say, so you guys understand better. And finish line is very, very important. It has to be supragingival, not equigingival. Supragingival by 0.5 millimeters. And if you have more than 1 millimeter, it's a critical error. If you have it subgingival, it is a critical error. So it should fall between 0.5 millimeters all around, and it has to be continuous. And again, the shoulder, when you create your shoulder, it has to be, they look at it like this, and then they say, they run the 1 millimeter ball burnisher all around this and then see if it is actually uniform. And if you have minor like shortness like 0.9 or 1.1 here and there, it's acceptable. Not acceptable, it's like falls in standard, but try to keep it as uniform as possible with 1 millimeter. And this is another thing. Once you finish your crown prep, make sure your tapers are in 68 degrees. That is standard. That is excellent criteria. If you have more than 8, make sure it is within 10 degrees of taper. If you go beyond 10 degrees, it is a critical error again, which reduces the retention of the crown. So make sure you be below 10 degrees, but 6 to 8 is ideal. Excellent prep. And remember, don't tilt your burr to create that taper, because your burr already has the taper and it will create that taper for you. So make sure your burr is parallel to the long axis of your tooth all the time. Do not tilt it, especially right-handers. Make sure you don't tilt it more towards your right because of your habit, and you try to create more taper on the distal side and less taper on the mesial side, and you will have an undercut here on the cervical part of the mesial surface. So make sure you create, and make sure always check every trim, every 10 seconds, every 30 seconds, check if your burr is parallel. Check your burr is parallel to the long axis. Continue. Okay, and this is once you finish all the crown prep, make sure you touch your crown and see for your tactile sensation if there are any sharp margins. Usually what I do is I use the polishing cup, the dark purple polishing cup which they give for composite, put it on the slow speed handpiece. This is the last thing. If I have time to it, I'll just put it on the slow speed and with water again, rub it all around so there are no sharp edges, and it will give you a smooth finish to see. And then when they look at it and it looks pleasing, they'll have already a positive mindset in their mind that it is a good prep. So even if you have minor errors here and there, they'll be like, but it looks good, but it looks good. That's their attitude towards it. But when they look at it and it looks crappy in the beginning, they won't have good opinion around it. But so make sure it looks visually pleasing too when you're doing it. And again, as I mentioned, burr orientation to the long axis of the tooth, very, very important. Remember, right-handers, be very cautious. Do not tilt your burr towards your right side, which is very, very habitual thing to do. I do it all the time. That's why I'm not discriminating anyone. I'm a right-hander too. So, and remember the flow of reduction. I usually do incisal reduction and then go labial reduction and then proximal and then go to the lingual part. But this is standard. Everybody knows how to do this. But in the lingual part, make sure you make those 3 dents like you do on the buccal side or a labial side. On the lingual side too, you make that dent 1, 2, 3 by the cingulum and then attach the mesial part and the distal part and then all together. I'll show you a picture. I know it's a lot of information that I'm dumping. I'll show you pictures which will make better. and measure the cingulum always. Make sure you create that 2 plane on your labial surface. And how you do that, again, this angulation, follow the adjacent tooth. Use always your adjacent tooth, which is not prepped, as a reference point, and then use that axis, long axis of the tooth, and then trim it. Like, do not tilt the burr. If you once you get the long axis of the burr according to your adjacent tooth, place it on the tooth and then trim it. And then again, if you check on the incisal part, your plane will be different on the tooth, right? So you use that angulation of the burr onto the incisal edge and then trim it down. So you will still have the two plane preparation, but still not going to create the undercut. If you tilt more cervically, you will create that undercut, which is not acceptable again. So your prep goes straight and then second plane. Okay. And putty guide, use always a putty guide. I'll show you pictures how to make the putty guide quickly. And always pass the burnisher incisor gingival to see if there are any sharp margins, and make sure it slides down all the way through by the finish line, and there is no catch. If you see a catch, means the the finish line has the ski jump or J margin, which you have to go back with your enamel hatchet to smoothen it down. I usually don't use enamel hatchets for crown preps, but if you're comfortable using enamel hatchets, you can use it. I don't like scraping of the crown when it comes beautifully. Make sure you create that finish line properly in the first place, so you don't have to create that ski jumps. And one more tip, when you are going proximally, make sure you look at parallelly towards your model, towards your long axis of your tooth, and then position the burr all along the length of your crown to 1 millimeter of gingival clearance, and then position it there, and then trim it all the way to the back. Do not lift the burr and then slowly trim a little bit and go down. What you try to do is you create more taper. That is my problem. Most of us have it, and most of my students had the same issue. So I would recommend position the burr and then do not lift it, but make sure you're looking at the long axis of the tooth, both the teeth, adjacent teeth too, and then pass the burr all around and then cut out with your interproximal burr. And then go back in with your shoulder burr to create the shoulder on the proximal surfaces. That makes it easier. I mean, at least that makes it very easy for me. And that is, so far I did not see anybody with doing that way that did touch the adjacent teeth and damage the adjacent teeth.
Doc, I have a question. Which burr do you recommend using for the interproximal reduction? Because I don't see any interproximal burr in the
So
kit.
you see 850012.
Oh,
first
okay.
on the front row.
Okay, yeah.
It is your interproximal burr. I personally use 8878K016, which is the chamfer burr, to create the rounded shoulder. But ideally, we are supposed to use this 8847-016.
Okay. For the whole margin, right?
For whole margin. Always remember, once you finish the margin with this, finish the preparation with this, go with the same size burr, which is finer, and so to create that smooth surface. You cannot have these diamond scratches on the prep. It is again a diamond.
What speed do you recommend using for the polishing, like when you're using the red stripe burr?
40 to 60K.
Okay.
Yeah, 40 to 60K. Again, I'll tell you guys at the end about the speeds quickly.
Perfect.
Somebody remind me if I forget, sorry.
Yeah, I will. Thank you.
Yeah, this is a brief idea. Remember, it has to be equally 1 millimeter all around and 1.5 millimeter at the tip of it. These are the burrs we usually use. We have in our armamentarium, but ideally just use this burr to create that shoulder. But do not put a lot of pressure on the tip of the burr, which you will create a sharp end here. We don't want that sharp end. It has to be rounded, right? When I use that 6847, I create that 68 or 8847, I create that sharp ledge. So that's why I have a habit of using 8878, so that I can create that rounded shoulder instead of this. But with this, it is prone to have ski jumps or J margins. So if you don't know how to use this burr comfortably to create that rounded shoulder, just keep with this and make sure you don't put a lot of pressure on the tip of the burr. And you use the football diamond to create that clearance on the lingual surface. And if you create a ski jump or a J margin, and then you are not comfortable using your enamel hatchet, you can use always end cutting burr, which will not trim any of the tooth but the flat end of it, right? So you can pass that flat end around the finish line to create that to trim only you don't pass it all along. If you pass it all along, you will create the sharp end where we expect to have a rounded finish line. So make sure you use it only where you have the J end or ski jump. And moving on, this is very, very important, guys. So this is the mannequin head or Dexter head you will have on your exam. This is the exact one it will be on your exam. And this one is like a pilot joint. It is sitting, it's like our neck, technically. It is sitting on a ball joint and it rotates all around. And it is very, very, very easy and flexible to move it. But you see a round knob here. This is actually drives that to move right and left. So make sure it is tightened all the way down. I had this problem when I was doing my composite finishing. Glad it was in finishing point, but it was not tight enough and it got loosened. And then my finishing burr almost went and hit onto the adjacent teeth. But God bless, I did not do that mistake. But make sure it is tight enough, the screw is tight enough so that it doesn't move when you're working with your burr. Okay? And it is very easy to move, like it will move right away. So keep tightening it between each task and make sure it is not moving. But when you try to tilt your head, I mean, if I'm working on the right side of the mouth in the maxilla, I tilt my head towards my right and go to the left so I can access the visibility of the buccal wall better. So when I turn it, loosen it, turn it, and make sure you tighten it. Do not forget to tighten it. Okay. And then again, when I'm working on the lingual side of my maxillary molar, let's say I turn the head to the leftmost possible way and I turn towards my 10 o'clock position and then see the lingual wall clearly with the visibility. I mean, I can see it so that I can trim that wall especially. So again, if you don't see the wall and if you don't see the burr and if you don't make sure the burr is in the long axis or parallel to the long axis of the tooth, you cannot cut the tooth. You have to visualize all of them. Again, one more tip. Maybe I don't know if you guys see me. Can you see me this? Again, make it very easy. Can you guys see me? Yes. So this is your Darwin head, let's say you're sitting on, and then if you're working on right maxillary molar, make sure your mirror is not parallel to the long axis of the tooth. It is in 45 degrees angulation. The mirror is, this is the mirror. This is the tooth, let's say, don't put it here to see it. You can't see it. So put it in the 45 degrees angulation and then look this way to reflect the light there. And then you can see it as it is if you put it in 45 degrees. To put it there on the top to see it, oh, I can't see it. You can't see it. And any direction, if you want to see the mesial part of the cavity, 45 degrees here. The light reflects exactly how it looks like. You look at the mirror, then you can trim it. If you want to see the lingual part, 45 degrees. See the buccal part, 45 degrees. Then only you can visualize the tooth. If not, impossible. Right? Got that point?
Doc, I have a question.
Yes.
So I struggle when I'm doing number 3, class 2 in maxillary. So I can, like, when I am doing when I want to see the buccal wall, I put it like 45 degree towards the palate. Like my mirror is towards the palate.
Okay.
When I'm doing buccal, when I want to see the proximal buccal wall, okay?
Yeah.
And when I want to see the proximal lingual wall, my mirror is towards the other side, 45 degree.
With the same mirror concept, you have to move the head and move yourself too. Are you doing that?
I'm not moving the head.
You have to move the head. Again, this is something I learned from one of my mentors. which helped me big time.
I
So
want to
again,
learn, please.
let me show you. Can you guys see my my arms
Yes.
here?
Yes.
Right. So this is the head. Let's say, turn it all the way away from you.
And you are at 11 or 12?
And I'm gonna let me finish. Okay, so you put it all the way away, and I'm going to 10 o'clock or 11 o'clock, and then I can see clearly. And then when you go to 1 o'clock position, you put it away, and then you can see this side.
Okay.
Does it make sense? And usually, if you turn the head all the way away and then look it at the 45 degrees angulation, if you turn it towards the right, you can work on the buccals or buccal wall clearly. If you turn towards the left, you can work on the lingual wall clearly.
Got it.
Got it?
Yeah.
Anybody else with the chair position questions? I can continue further.
And also, Doc, what position do you suggest for the when we are, say, for example, working on the axial wall, not the buccal or
Axial wall, I always go 12 o'clock position behind, and I lift the mannequin. Can you see me again? Sorry. I lift the head as much as possible. And then I go 45 degrees of mirror vision this way, and I can see the wall straight. This will be perpendicular to my axis of the burr. So I have my burr like this, and I'm looking it like this and working on my axial wall. But 12 o'clock, lift your head a little bit, you can see it straight, and you can go in there perpendicular to the floor of the tooth and parallel to the long axis of the tooth. And before you with the crown, yeah, sorry. Were you asking?
No, go ahead. I was saying that we couldn't see your hand, the hand that you were holding the mirror with.
Okay, sorry. Again, let me do it.
Fine.
So head up, right? And then 12 o'clock position, and then mirror 45 degrees more distally or more mesially. It depends on how you want to see it. I usually go more mesially, and then I position my burr perpendicular to the tooth. Sorry, parallel to the long axis of the tooth and perpendicular to the floor of the tooth, and then trim it.
Got it.
So if you push it more lingually, I mean more distally, the mirror, the problem is the water spray will go on the mirror all the time. You can't see it. And also one more thing, I'm not going to put this in my mouth, but I'm going to show, if you see my head, you keep your mirror by the corner of your commissures or by the lip. Do not put it all the way in, and you can't see because the water is pooling on the mirror all the time. Keep it in 45 degrees, but keep it as far as possible and put it by the commissure end or on the buccal by the lip. Do not put it all the way in. You cannot see it, and you cannot work with the water pooling on it.
Perfect. Thank you very much.
Okay, that makes sense, I guess. And again, guys, make sure the very, very, very important thing you bring with yourself is your confidence and your presence of mind, and all the well wishes from your family and friends, from me too. And be focused. Don't panic. It's doable. It is not something new, right? And again, ergonomic, which we just discussed about it, make sure you keep your back straight. If God forbid, if you are looking at an direct vision with upper maxillary and you bend around and faculty walks around with the grading sheet, you are done. I'm repeating this again. There will be faculty who are actually scrutinizing you. I won't take the name, but one of the faculty will be walking around with a grading sheet to mark your positions and infection control. So if you by mistake bend in and then they're walking behind you and you don't notice, you're done for the day. So do not bend. Make sure you do it in invisible, in indirect vision all the time. With your lowers, obviously you can just turn down and legs, do whatever, right? And again, one more thing, infection control, all the barriers are all on, every time on. If you're coming out of the op for some reason, make sure you take your gloves off, hand sanitize, and come in. When you go into the op, wash your hands, paper dye. Again, gown on first, hand sanitize, and then mask on, hand sanitize, loops on, hand sanitize, and gloves on. Once you put your gloves on, you're not touching anything else apart from the instruments and the mannequin. If you're touching anything else, make sure there is a barrier on top of it. And they will put all the barriers and everything will be set up for you, like an amazing assistant would do for you, right? We do that for you guys. So you go there with your presence of mind, make sure you follow all the infection control protocols, and then ace the bench test, right? And time management is very, very important, guys. So there will be clock on every other wall possible. And if you don't use your phones, don't bring your phones into the bench test. If you are missing track of time, ask somebody, they will always tell you, and there will be a time visible on every wall. And usually they give timers too, actually. I think I got a timer, like they give you a timer in front of you, they will be running, counting down, makes it easy. If you don't have a timer, there will be a clock on the wall on every side for you, and keep a track of it. I would not spend more than 40 minutes for each prep. And then at the end, I will leave myself half an hour so that I can see if I have any minor errors and then fix them. Always, always, always critique yourself once you finish the prep and make sure you find the errors. Be hard on yourself. Okay, is this wall right? Is this wall left? Blah, 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 wrong or right? Fix it and then do it. And this is something I think Avatar, actually one of our group mates here, he already met me, and this is something I always emphasize it. Maybe he'll be tired of this listening. Anyway, so let me. In the morning before you go to bench, this is the exercise I usually did every day in the morning. I sit somewhere calm and quiet, no disturbances, sit there, and then close my eyes and then imagine all the requirements of the tooth prep. And I walk myself, I imagine myself sitting in the cavity of class 2 ideal prep, and then, okay, amalgam prep, my occlusal walls are convergent. My wall is 1.5 here, it is 2 here, and then it is smoothly transitioning into the buccal proximal surface. And then how my proximal surface should merge, and it should slowly slide out and then exit in 90 degrees. Is it exiting in 90 degrees? Okay, make sure you exit it. And then how is my axial wall? And close your eyes and visualize it in your brain, which will actually be fixated in your head, which actually shows on your muscle memory to get it right. If you want to get it right by the paper and just I want to get it right, you won't get it right until you are programming it in your brain. So sit down every day in the morning for 5 minutes or 10 minutes and imagine how an ideal prep should be, and then program your head. You will get it right. I promise you'll get it right. Okay, so I think we kind of had interactive session on the way, but I'm gonna quickly jump into the pictures. So we are actually late already, but so you guys can see the pictures what I wanted to show you guys, because I did make them fresh because I couldn't use my old preps. Share, and can you guys see the folder called L'Amore? Sorry. Anyway.
Yes, it's visible. It's straight.
Perfect. Right. So the reason I put them aside is for you guys to see the details, so I can zoom in or zoom out, right? So this is the basic anatomy of your molar, right? And then I marked my cavity outline here. See, it is just following the exit angle, creating 0.5 millimeters, not more than that. It is creating 0.5 millimeters more than that here. And then it is falling in the pit and fissure grooves. And then it is only extending a little bit and covering there to create that retentive form. And I initially just trim the cavity on the occlusal part and leave a thin layer of enamel here still, so that I can bop it down once I create my proximal box. Always remember, create your occlusal proximal area too before you dig in proximally deep down, so you understand where to position your burr and how much you have to trim. If you don't do occlusal part here too and then you try to do it, you will be having a hard time to merge that class 1 into with a smooth transition into the proximal box. Does it make sense, guys? Are you guys following or tired already? Sorry.
No, doc, it does make sense.
Okay, so this is another picture of it after I finish my proximal box. See how flat and smooth it is. And also, this doesn't have retentive grooves yet. I know you guys might ask it. I'll show you another picture. Just follow me, hang in there. You will get all the information. And see, if you see, do you see the shadow here? Why is it created? Because of the convergence which I tried to create with my 330 bar or 250. But 330 bar is ideal. I will go 40K and then slowly create that convergence occlusally. And then my axial wall is following that mild contour of the curvature of towards the pulp. It is not going flat. So if I make it flat, it will be like, so look at this thumb pointer, it will go straight like this. But it is going a little convex, which is more than enough. And it don't have to make more obvious. If you make it more obvious, you won't have the width of your gingival seat all the way through with the same distance. And here, if you see, I am creating smooth transition into the pit and fissure there. I'm not, this is my high prominence here, and then here is my oblique ridge, right? And I'm not even going into half of it. I just only took 1/3 of it. I involved only 1/3 of it, and then creating that smooth transition into the cavity.
Doc, do you create the proximal convergence with the slow speed as well, like 40-50K?
Sorry, what is it again? Please repeat the question.
Said, I remember you just said that the occlusal convergence you do at 40K with 330.
I do that with 250, 245 or 255 burr. When I am trimming my initial proximal box, I tilt my burr a little bit, so I create that. And also, when you are trimming it, you put your enamel hatchet and then scrape it to the top, right? You're putting the enamel hatchet here and then creating this. I also do this to smoothen it because the burr will create that sharp lines or whatever. I do the buccal wall to smooth it for a second, but I'll do more pressure on this gingival seat, less pressure on the top, so it creates that convergence.
Got it. Thank you.
Does it make sense?
Mm-hmm.
Okay. So let me go to the next one. There are a lot of pictures. Sorry, guys. I think this I showed you guys occlusal part of it, and also look at this picture for the design of the premolar, which I marked already. It is more obvious, like it is. You can see the difference between it. I'm not creating a dovetail. That's not a nice picture. This is a nice picture. Okay. Here I can show you guys. Sorry. So can you guys appreciate the retentive groove I created here? Do you see it on the molar, on the surface? On the buccal, I did not give the retentive groove for you guys to see the difference. If you give the retentive groove, it will be like, it will look like this. But it will, if you don't give it, it will look like this. Let me zoom it more probably.
But we have to give buccally as well as, right, Dr.?
Yes. I just wanted to show it to you guys.
Oh,
so
got it. Yeah.
Made a rub without it on buccally. So lingually, see there is a retentive groove which is following only on that line angle which I explained earlier. And my exit angles are 90 degrees here. Exit angle is 90 degrees here. There is clearance, but the angulation of the photography, like I'm not a pro at taking photographs. As you can see already, no lighting, no proper lighting, but I'll do best next time anyway. Maybe once you guys are in Buffalo, I can show my work directly, and then you can help yourself for summer program and see the difference between occlusal design of the amalgam and the composite. Does it make sense? Like, can you see the difference between both of them? And also the exit angles are going in, not in 90 degrees, they are actually going out, divergent. Okay, so let me move. This is another picture to make it more visible for you guys to see the difference between the difference between the composite and amalgam preps.
Doctor, do we get fender wedge in the exam?
Yes, you get fender wedges, but I don't use them. But if you guys want to use it, you can definitely use it. I'm more than happy for you guys to use it, but I don't like them. I mean, I can't see properly. Basically, when I have my fender wedge on the side, when I tilt my Darwin head to the right and left, and I'm trying to see the edge of my buccal wall or lingual wall to trim it or to like shape it, this fender wedge reflection of the fender wedge through light will always obstruct me. I had really trouble using them, so I just took them out. And then I always, because when you see both the surfaces of your adjacent teeth and your actual trimming wall parallelly with your vision, you see where the burr is going exactly. You don't have to have fender wedge to protect the adjacent teeth. I mean, it is good to have it, but it is, if you can visualize it better, you know how close the burr is going, so you don't have to like have fender wedge, but they will give fender wedges.
So what do you suggest using? Nothing?
I use nothing. I suggest use nothing. Be confident, don't touch it. But if you, let's say you're doing your lingual wall, which is more easy, and you trim it, and then you have nice exit, and you do not touch the tooth, and you're doing the same, and you're not confident, then use your fender wedge to do the buccal wall. But for the buccal walls, yeah, and having fender wedge is better, so that you won't touch that recently.
And Doctor, we are getting 6 hours for 5 projects, right?
I think you guys start from 8 o'clock, but 9 o'clock you will, 8 to 9 is your orientation, 9 to 4 is your prep time, 9 to 3 is your prep time, and you'll have a half an hour break.
So
Please do math. I'm really bad at math, my bad.
So 5.5 hours.
Yeah, 5.5 hours, but you can, break is optional.
Okay.
You can skip the break and then you can continue and then go back once you're done and then grab your lunch and meet all your new friends and get out, but it's up to you. And this is something very, very important, guys. Please look at the image. Once you create the clearance, how would you measure that 0.25 millimeters to 0.5 millimeters clearance? It is really hard to measure it, right? But what the faculty does is they push the probe into the clearance and see how much does it go in by the clearance. If it goes less than 0.5 millimeters, means you don't have enough clearance. And if it goes 2 millimeters or just 2 millimeters, you have enough clearance. If you have more than 2 millimeters, means it is too much clearance. But on the lingual side, usually you will have a lot of clearance. It is easy to get clearance when you try to create that walls, like you create more clearance usually on the lingual part, but try to be very conservative. But 2 to 2.5 millimeters doesn't hurt, but make sure you put your probe, shepherd's hook, and see if it is going that 2 millimeters into it. And the same applies to the gingival seat too, like check if it is going in only 2 millimeters, and then once you do it, or you can use a pencil to mark it on the probe for 2 millimeters and see if it is reaching that 2 millimeters. They'll give you a pencil too, so shouldn't be a problem. And it applies the same with the your composite preps too. Clearance, buccal, lingually, and gingivally. Make sure you use it. And I think one of the pictures I have a better visibility of oh god, where did it go? No, I think this one. Let me zoom in, guys. Can you guys see there is very thin trim of my bevel? Do you see it is very faint bevel? It is not too prominent. And then if I took the picture more occlusally, like 90 degrees, you can still see the clearance. I checked it with the probe, it is not visible here anyway. But the bevel should be very thin and faint, but always bevel, don't just do the mid part of the gingival seat, always start from the buccal end to the lingual end, all the way around. And always see my axiopulpal line angle is not sharp. I still gave a bevel which is very faint. You don't have to make it more obvious. If you try to make it more obvious, if you are increasing the depth. Ignore this crown. This is a temporary crown, right? Sorry. And if you see the amalgam prep, I swear I did not put bonding material there. It is actually smooth enough, so it is shining. And make sure you round the axiopulpal line angle. Okay. And moving on to the next picture. So this is how you check your depth, guys. You pass your probe all around the occlusal part of it, and then see if it is 1.5 on the deepest part, and then 2 at the highest part of it. And with the composite restoration, remember to use your explorer to slide it onto the KO surface margin to see if you have any catch or flash, and remove it. Again, this is my composite MOD prep. See, I have like a groove running all around and then going to the deepest point of pit. And then I created a line here to go to the box, and then here another line, and here another line, here another line. And also I created a, you know, on the mesial and distal part, they'll have a midline groove, midpoint of the marginal ridge, you'll have a groove. I tried to create that, and my professor said, no, you don't have to be that detail oriented. She was, okay, anyway. So you make sure you create the height of your marginal ridge, and make sure this is equally in height with the adjacent teeth. I actually kept this tooth for this presentation. One reason is when we were asked to do this second premolar, I started doing on the first premolar in confusion in my summer lab. Please, please, please don't do it. Make sure you count your teeth and check which teeth you're working on and start on that tooth. I did start on this. My professor was like, you know, you can't do that, right? And I was like, okay, sorry, I did on this one. So make sure you count your teeth and go right. I showed this picture, guys, already. Remove the excess on the proximal surfaces. And quickly talking about crown preps, make sure you put 3 lines on the labial surface of your future prep, and then put the putty. And putty is something, this is very important. I know everybody knows how to take the putty, but still make sure your putty extends all the way to the base of the model till here, so that it has stability. I'll show you what I'm talking about. See how my cut sits on the base of it so that it doesn't move, and you are measuring it right. Because when you submit this model, when you leave the model on the mannequin of your exam, the faculty will check with the universal putty guide, which they made in the same way, so that you are following the same measurements too. So I'm emphasizing this again. Make sure you have your putty all the way to the sulcus so that it seats properly and your measurements are perfect, right? And then once you take the putty, you are transferring those 3 lines, and then you are cutting all those 3 lines out. And then you will have mesial part of it, which is the mesial measurements 1. And then you will have central part of it, which is 2. And then you will have the distal part of it, which is 3. You have those 3 pieces and put them in and measure it all around with all 3 of them, so that your preparation is equidistant or in the same 1 millimeter all around the tooth. And I'll show you another picture where I put all those 3 pieces here. See, this is my mesial part, this is my distal part, and that is the central piece. And see how it is seated all the way on the box of it, so it is stable on the palatal rugae and then on the buccal edge of it. So I have them seated properly to measure it all the way around.
Is it easy to cut that narrow part?
That easy. Don't even like stress about it. You can just slice it down, but be careful. Okay. Don't cut your finger. But it is easy to cut it into 3 pieces. This is standard. Every prep you do in future in Buffalo, they will check every prep with this. And then see this the patia, you can appreciate the adjacent tooth prep is all around. See, the seat is uniform all around. That is what they're gonna like expect you guys to do. Okay, quick and quick. Okay. So again, slide the burnisher from the top of the tooth to the bottom, and it shouldn't have any catch. It should slide off. Means your finish line is smooth, right? And let me show you quickly 2 more pictures, which are the measurement. So you have to measure the the finish line should be 0.5 millimeters above gingiva, right? And you all around, you have to measure it from there to all around the tooth and see if it is actually like this is the premolar. Sorry, ignore that, guys. So you have to see, make sure. See, it is only 0.5 here. It should be all around 0.5, not more than that. And this is one of the preps I made, guys. If you can see on the, you will see how smooth it is. It doesn't have any sharp ends, and the tapering is like straight, almost straight with 4-6 degrees, not more than that. And then uniform trim of the thing, and the palatal surface is smooth, and you can see there is no sharp ends. And these are my other preps. If you see the surface, how smooth it is with fine, not even any fine lines. So you have to make sure you get it. How would you get it? Remember, I told you guys, use that dark purple polishing cup, and then with water you run around it. Don't put pressure. If you put pressure, you're trimming the tooth more. You just smoothen it, and then it will actually smooth all of the surface around. Does it make sense? And I'll show you 2 more things, and I'll be open for questions. Or I think I did late today. I'm sorry. Yeah, anything else to show? Let's see. Here, guys, this is a quick thing. Do not scan these QR codes, please, and thank you. This is quick guide to show you guys. Do those 3 dents, extend those 3 dents, do that incisal, or you can do incisal and do this vertical, and then join all of them, and then do the proximal parts. And then in the lingual, this is what I was talking about. So see how we made those. I'm trying to zoom in 1 second. See how we tried to make those 3 dents, and then connect the mesial one, connect the distal one, and then connect both of them, so that you will preserve the cingulum. If you do it all around once, you are trimming a lot on the right side or the mesial side of the cingulum, or if you do it all around from this way, you're trimming a lot on your distal side of the cingulum. So you can keep it uniform on all the sides, right? And then you can just use the diamond burr trim all around and then smoothen it. And one more thing again, see, this is how you measure it, guys. It has to measure all around 1 millimeter, and then 1.5 on the incisal. Again, 1 millimeter, 1 millimeter, 1 millimeter. And the cingulum length should be 2 millimeters. See, exactly it is 2 millimeters. The height of the cingulum is sitting on 2 millimeters exactly. And then it's still, this measurement is 1 millimeter. It doesn't go lower than that, right? And then taper 6 degrees is ideal. This is standard. This is a fail. Less than 6 or more than 15 is a fail. And then I would strongly recommend to keep it all of your measurements in excellent condition, so that even the grading on your preparations or grading on your benchmarks are also part of your selection criteria. So make sure you do everything in excellent, so that you have good points, and they are point based. So you'll have more points, which will be considered helpful to be selected to get acceptance. And again, this is 0.5 all around, as I mentioned, and no ski jumps, as said, and no undercuts. Okay. So I think I am not satisfied yet that I gave enough information, which I have a lot of resources, but I think we tried our, I tried my best to put everything in there. If you guys have any questions, I am open for quick questions. And I also mentioned my, 1 second before I come back, let me show you this. I guess most of you guys are all following already in Instagram with DDS, the big American dream I created as a professional page. You guys can always ask questions before you go on that Instagram, or I'm more than happy to give my phone number to just text me on WhatsApp, Only for you guys, don't share it to everybody, so that I already have like gazillion messages in my WhatsApp actually from your group. Let me close this down, and I am open for questions, guys. Sorry.
Doctor, I just wanted to remind you that you wanted to talk about the speed.
Oh yes, stop presenting. Thing, it's the speeds, guys. Remember, when you are cutting the actual preparation, on the occlusal part, on the proximal part, you are making that initial cut, initial depth. Oh, maybe this is better. Initial depth, initial is 200K. And if you are finishing the restoration, finish, it is 40K. Finish the preparation and restoration, 40K. But when you are doing composite, if you are finishing composite with your purple points, make sure you have it to 20 to 30K. And when you are trimming composite, have it 80K. Don't go 150K or 200K for trimming composite. It is very, very sensitive. So trim composite 80K, polishing composite 20 to 30K, and finishing the resto or prep is 40K. And when you're trimming initially, keep it to 200K. Do not go slow. If you go slow, you are making more scratches. And water always. Any more? I think I got everything right. Yeah, for crown preps, it is the same again. Use 200K when you are using green diamond, and write that down again. Yes. Green diamond. Use 200K. And when you are finishing the prep, use 80K with red band. For crown prep, ACC. I think, yeah, 200K for green diamond and 80K for red band. And then remember, I told you the secret tip using the polishing cup, the dark purple polishing cup. Put it on 40K or 20K is fine, but 40K is fine.
Thank you so much, Doc. That was really helpful.
Yeah. Any other questions before I let you guys go? I think we are half an hour over the time as we expected.
Doc, can you please run through the burr, like which all burrs for composite, amalgam and crown?
Okay. Let me see. I closed my presentation and then it is gone. So you asked me the burrs, right? Let me show you the picture again.
Yes, Doc. Just from that buffalo kit, just run through that.
Yeah.
Fine.
1 second. So again, it is now presentation. Can you see it now?
Yes, Doc. Yeah, totally fine. Yes.
So again, I would use 255 and 330 for both composite and amalgam preps, and one for a quarter round for your retentive grooves. And I can use flame, red band flame, or 850012 for my gingival bevel on composite prep, or I can use a GMT or a enamel hatchet for my bevels, and I would use 884716 for your shoulder and your tooth preparation for ACC, and always use 6847016 for your finishing, and then use 379F023, which is a football burr for your palatal reduction, and use this again, the final version of the same, to smoothen the prep. And you can use the end cutting burr for your ski jumps reduction, but make sure you don't use it a lot. Try to avoid ski jumps and be very careful. Don't run it all around. Just use it on the ski jump where you have at that points, right? And also you can use flame burr for occlusal trimming of your composite preps, composite restorations. Once you finish the adaptation of composite, and if you see any flash, you can use the flame burr and make sure you put the flame burr on the KO surface margin and trim it down so that you can have better adaptation of your composite to the KO surface margin, and so there is no flash there. And be very careful when you're using that to reduce the speed and have a lot of water, so that you can adapt it around. And also you can use carbide football, fine carbide football, which is a red band, to reduce any excess material if you have on the composite restoration on the occlusal part of it. And do not use this football carbide on your marginal ridge which you created. It will trim a lot, so be very careful not to use it. Only use in the occlusal pit and fissure part of it. If you want to shape the marginal ridge still, use your flame to just smoothly shape it, and then go from there. And also you can use actually enamel hatchet. Don't tell anybody that I use enamel hatchet. You can use enamel hatchet to smooth it. Like I use wax block where you use to scrape it and slowly finish it and smooth it. I used enamel hatchet to actually smoothen the marginal ridge on the occlusal part of it to keep it glossy and smooth finish. Do not apply bonding material after you finish polishing. They know it. If you apply it, they don't like it. So don't do it. Just use your purple points to finish up all around. Use the pointed version and then the disc version on the proximal surface and smooth everything down. Good. And water. Remember to keep water all the time.
Doctor, one quick question. You for the J margin in ACC, you said to just check it with a probe tip, right?
Ball burnisher.
Okay, so it should not sit, right?
1 second, sorry. So once you do this, can you see my screen?
Yes.
Once you slide it down, it will slide and will not catch on the seat. It will slide down.
Okay.
If it catches there, you have minor J margin.
Got it.
And you will hear that thug sound, like a metallic sound, that you have the catch. And then once you feel it, you stop it and then you trim it down.
Got it. Thank you so much.
Okay.
Doc, you said for the polishing of the composite, only to use the disc and the cone, because I heard before you said not to use the disc.
It's soft flex disc.
Oh, okay. Yeah.
Soft. Okay, let me stop this presentation. So disc, in the sense you will get soft flex disc. You know soft flex disc, right? The 3M soft flex disc, which will go on the material and then you trim it.
Yes.
Those are for anterior. You will get that too.
Okay.
They will have it. But if you don't get it, good for you. If you have it, don't use it, because it is very aggressive and it is only for anterior. If you fill excess and you trim it down and shape it down so you have glossy finish for your anterior composites. For your posteriors, you are better off with your purple points, which have points, disc and cups. So I usually use points and discs of that purple kit.
Okay.
Not the soft flex disc.
And one more question again. The retentive grooves have to extend only till the pulpal floor, or not to occlusal part, right?
Again, pulpal floor,
Mm-hmm.
gingival seat, and
Got
you
it.
have 2 line angles here. So
Yeah.
from this point angle to that point angle, it has to be extended, not over that.
Okay. Thank you.
Okay. Any last question, guys, before I let you go? And sorry, Flynn, it's supposed to be 1:10, 1:15 to be done. It's almost 1:40 now, my bad. It's just the excitement. Trust me, guys, it's just the excitement to share all the knowledge and information, whatever I have, to help somebody to see the green side, which I am enjoying right now. So
I'm very grateful. That was really, really valuable and informative. Thank you very much for your time, Doc. I really appreciate it.
no worries. Thank you, Dr. Tahir. And remember, stay focused. Don't lose this golden opportunity. One last thing for you guys to add on. with the interview, I know you guys might have got a lot of help around with all the information and stuff. So we are all in a foreign country. When you go home, you sit with your friends and sit with your mom and share all your experience, what happened in Canada or happened in US or wherever the country you are in. Or if you're going for a vacation, you go back home, you sit with them casually and like share everything and show the passion, what you enjoyed, show the happiness where which you felt, right? I want you guys to do the same with your interview too. They are like your friends. They are not threatening you. They are not asking so many questions. Buffalo interview is just about you sharing your personal experience about yourself first, then dentistry, and connect both of them and talk about your experiences all the way through and tell them what you had, challenges, struggles, and your happiest moments, and what you share with your friends. Sit down and have a coffee and talk to them the same way you talk to them personally, and they know that you are talking from your heart, not making up an answer. And then if you do so, you will be selected right away. They don't even care about the other points or something. They know you are a good human being. They know you are an amazing person, and they will select you for sure, no matter what. So keep that in mind when you go for your interviews, and make sure you bring your formal set and be ready to be passed by the bench and then go for your interview. Don't forget that you have to go in formal attire. Yes.
So the interview is mostly just personal and based on our CV, right? Anything specific you'd want us to be prepared for?
They won't ask a lot of questions about dentistry. The interviewers are not clinical faculty mostly. There might be one or two clinical faculty if we don't have any admissions team, but still they are looking at mostly your personality.
Got it.
So for me, I'm gonna quickly say this. They asked me, tell me about yourself. That's it. And half an hour down the road, they know my life story in a good way and bad way too. I told them my hurdles too. I told them my personal story. I told them my struggles. I told them my achievements. And I told them what I enjoy in life apart from dentistry, more than dentistry. I in fact spoke about a lot of gardening and cooking, which I enjoy, and I also enjoy skating. So I spoke about skating with them, and they asked me why Buffalo. I told them Buffalo is very close to home. I'm not gonna lie about it. It's very close to home. I'm going there right in a minute, in an hour and a half. But I never tried buffalo chicken wings, so I spoke about buffalo chicken wings with them. And after this interview, I'm gonna go actually try buffalo chicken wings. Do you have any recommendation of the place where I can go eat buffalo chicken wings? This is the question I asked them.
Wow.
So you keep it more personal and common, and then and when the only 3 questions, talk to me about yourself, and then what interests you, and there are open-ended questions after they talk to me about each thing. When I say that I enjoy gardening, I do gardening with my wife, I have my home house with blah blah blah, and they say, okay, what kind of vegetables do you have, how much produce do you get, blah blah blah. Open questions around whatever I talk, right? And the last question they asked me was, do you have any questions for us? I told them openly, with all my preparation, there is a lot of peer pressure that you have to ask questions. Honestly, I don't have any questions for you, but I'm just curious about 2 things. They are not questions, you don't have to answer me, but I'm just curious about 2 things. One, is there a specific time or a day or a curriculum that dedicated for research in your school? I know it is research focused school, but if it is not in the curriculum, I'm totally fine with it. I'll find my ways. They explained me how research thing works after that. And the second question I asked them was about, what did I ask again? Yeah, mental health awareness, because I am proud to say I suffered with PTSD in the past, so I took a lot of help to be where I am here today. So I asked them, what do you do for mental health awareness? What do you do for your mental health support for your students? And what are the wellness initiatives that Buffalo does? This was my question, and they were more than happy to answer it. I'm like, I'm actually short on resources and wellness. Why don't you join and help with developing more strategies for wellness in our school? And also the way I explained my answers, one of the interviewer was, oh, I really loved your answers. You are an amazing storyteller. And I see you as my grandson, because my grandson talk all the same stuff too, and same future plans too. So I loved it, she said. Then I knew that I am definitely getting into Buffalo. So I ignored my invite from Pacific eventually. So be confident, talk to them as your friend. Okay.
Doc, I have one question.
Please, quick, sorry.
So do you suggest to wear loops during preparation?
3.5, I had $90 3.5 Amazon loops for my bench test.
Okay, but I'm not comfortable.
If you're not comfortable, don't use them. But I recommend using them so you can see the fine detail.
Yeah.
At least for restorations.
Oh, yeah.
Okay. Okay, guys. Thank you so much for your time and listening. And before I let you guys go, I am sorry if I offended anybody in any way of this disclosure of material. And I hope it was helpful. And I wish you guys really the best. And I really want you guys to want to see you guys on the other side. And maybe if I get a chance, I'll stop by and say hi on your interview days. I know where you guys will be exactly, so I'll just try to stop by and say hi, hello. And most of you guys are doing it on this Tuesday, right?
Yes.
Okay.
Yes.
We'll see you guys on Tuesday then.
Also, Doc, can you please share your number if in case we have any?
It's 647.
Oh my God, you were telling us like that. I thought you put it on screen.
647-234-4849.
234.
647-234-4849. I think a couple of you guys already have my number. Anyway.
Yeah.
So please don't share the number a lot. Ask me if you have to share it to somebody else before you share it. Please respect that. I really appreciate it because it will be easy for me to understand who I'm talking to, basically. Okay.
Thank you so much, Doctor. This was really helpful section. Wonderful section, I would say. I learned a lot.
Me
Thank you
too.
so
I'm so grateful that I'm here today.
Yeah.
Thank you so much,
Yeah.
Caapid Simplified as well for organizing this. And
Thank you.
so much
Actually,
for-
thanks to Flynn for all this effort and making the plan. I mean, it was actually Miss Meenakshi Subramanian's and Flynn's idea to do a webinar, and then glad I was able to get everything in one shape and then present it to you guys. I am very thankful to Flynn and Meenakshi to be that bridge for me to come to you guys and share all the information. Yeah.
Thank you for saying that, Tarun, but that's I mean, we barely have anything to play in this. We're just a platform. But I'm really glad that you were saying sorry earlier. I should be saying that. Thanks for spending that extra time. I think it's
No,
almost been
that's
3
okay.
hours.
I know. I am feeling so bad that I kept you awake all the late nights.
No,
I know
not
you
at
were
all.
sleeping
I just had to
well.
step out. That's why I'm in the car. But I'm glad that all of you all could get everything. But anyhow, the fact that he sat for these 3 hours and gave out his number like it's no one's business, I think is testament enough that he's here to help. And that's genuinely what we have worked with Tarun in the past. And we know that anything genuine really does pay off. And we firmly believe in that.
Yeah.
So that's why
Everything
he's here.
follows. If you are
Yes.
honest and genuine to help somebody, everything will follow. Money, happiness, and everything will follow.
I agree. We definitely believe in that. So that's why we're here together. So thank you
Yeah.
so much to all of you all
Thank
for
you.
joining even if it's last minute. And I also want to formally request from Caapid Simplified side on his behalf to not share the number or anything without asking him, because he's been really benevolent by sharing the information with you all. Good luck to all of you. I am also we also are really excited today. Just a bit of a minute just from my side. The team, Caapid Simplified team, is meeting together in Bangalore and India and working together. We work remote, but once a year or twice a year. Yeah, and Meenakshi is also here. So we were all together working while we heard one of our fellows got acceptance in Rutgers, and we were just overjoyed. So every time we hear something, we are also really happy. So really hope the best for you all. Good luck. And this recording will come to you. And if you need any other help to Tarun, if you don't get through with his number, you can contact us and we can
Contact Caapid so that they can reach me out too. Yes. Yes.
And funnily enough, what Tarun said about Buffalo Wings, I don't know if we had told you this earlier, we have spoken about this. Dr. Nourah, co-founder, when she went for the interview in Buffalo 5-6 years ago, also this was her conversation point. They didn't have many questions for her. they spoke about buffalo wings. So yeah, anything very genuine that comes to you as a conversation starter
Yeah, if
always
you
helps.
talk about it like from heart, they know it. They
Yes,
clearly know it
definitely
that
does.
you're talking from your heart.
Pretense
Yes.
to not. I think being here for 5-6 years, I know that pretense doesn't help. So be genuine, be nice. I love the anecdote that he said, like talking to your parents and your friends with that passion, speak to them, do that. Good luck, everyone. Thank you so much. Have a good rest of the day. Have a safe drive, Tarun. Thank you so
Yes,
much.
thank you.
I'll
Thank
be in
you.
touch.
I have 3 midterms next week. I don't know how I pulled this 10 today.
Good luck. Thank you so much for making. And
Thank
he
you.
was
Thank
insisting
you.
on today, guys, because you all have the bench on the 7th. So
Yeah, that's the reason
thank
we
you so
pulled
much
it.
for